Assalamualaikum warahmatullahi wabarakatuh. Welcome to the HEART webinar series for today. My name is Dr. Fatin and I am very honored to be able to be your moderator for the session today. For your information, HEART stands for Health Enforcement and Health Empowerment and Reform Team, and we are basically an NGO in Malaysia. And at the moment, our focus is really to help to enlighten all the junior doctors into all the medical specialties in Malaysia. And for your information, this is our 12th series of the HEART webinar for the junior doctors. We have actually go through all the other webinars in specializing towards being a specialist, the clinical specialist, including pediatrics, family medicine, obstetric and gynecology, internal medicine, sports physician, public health, and also the emergency medicine. And all these recordings of the previous webinars can be seen or can be watched in the Facebook HEART page. Today is our first webinar focusing on the medical research series. And today I am honored to be able to introduce to you our 5 panelists, which are quite, we actually select those specialists that are young, so that we can relate more to our target audience, which are the junior doctors. So inshallah today we will start our webinar with the first speaker today, which is Associate Professor Dr. Muhammad Saiful Bahri Yusof. Associate Professor Dr. Muhammad Saiful Bahri will talk to us about the introduction to scientific writing, as well as the knowledge, attitude and practice study. Just a bit of information about Prof. Saiful. Prof. Saiful is the head of the Department of the Medical Education in the University Science Malaysia Kubang Kerian, and he graduated from USM with the Master of Science and PhD in Medical Education. And Prof. Saiful is currently the Editor-in-Chief of Education in Medicine Journal, as well as the Regional Director of the East Asia of International Society for Emotional Intelligence Fellow. He is also a Fellow of National Higher Education Research Institute and also a Fellow of Center of Development of Academic Excellence and a Visiting Professor at Universitas Indonesia. Prof. Saiful has a wide and deep experience in research. He has been involved in at least 23 research projects and has written more than 100 articles. And his H index is about 15 in the Scopus and 11 for the Web of Science. And without further ado, I would like to invite Prof. Saiful to deliver his the first session, which is the introduction to scientific writing. Please, Prof.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And good morning, everyone. Thank you so much to the HEART for this opportunity to share something on scientific writing for the introductory. So I hope everyone can see my slide right now. Yeah. If not, let me know. Okay, there's a kind of a scientific writing introduction, so I'm going to be very brief, and perhaps I will highlight important things related to scientific writing. Okay, now we need to ask why scientific writing. So in any scientific community, so basically the purpose is to record data and the findings that we already already found in our research. And without a written record on the finding and observation of all of us as researchers, and maybe valuable information obtained after we have done so much will be lost. So I think this is something that we so much interest in recording our data through scientific writing. And the reality of scientific writing is basically, definitely, it's not a shortcut or maybe is there any cheat code for that. It's basically a journey, and a lot of planning involved with the scientific writing, definitely. And it's really depend on how we write our ideas or our message to communicate our findings, and definitely the content of the scientific writing. what we write is far more important, and we must ensure that it's relevant and appropriate to the audience. And a few things that I would like to share before I dive into the scientific writing. Just a tip for scientific writing that I always remind myself when I write any articles. One is tell a good story, definitely, even though it's a negative finding, but tell it in a good story way, because sometimes we can learn from negative finding as well. And then we need to create a good outline and title. So at the end, I will show you how to do it in terms of the title, to put a good title, and a good outline I will share a little bit afterward. And in terms of to communicate our paper, so people usually read the abstract first. So please pay more attention to write a self-contained abstract in our scientific writing. So I think that will be important. And write short and concise paper. It's not a novel. It's a scientific writing. So straight to the point is far more important compared to put everything and then we are just we just write so many but with a little message and content. So that is something we need to bear in mind. And then the last but not least, definitely as a person who are writing a paper, we need to constantly work to improve our writing skill. I think there is 6 tips that we should do a lot if you are trying to be a scientific writer. And don'ts, okay, this is something that I would like to emphasize. When we want to write, do not have too many plots, because too many plots sometimes will make readers confused. So I think make it short and sweet. And do not paralyze readers with results, because if you have results, do not put everything in the paper. Select which result is important and have significance to the readers. And do not curse readers with your knowledge. I know that we are having a lot of knowledge, but do not curse with all the knowledge. We pour everything in a paper. So please be empathy to our readers. And then we should not put excessive abbreviation and acronyms. Otherwise, you become mathematics paper. Because everything abbreviation, everything acronym, and at the end, people are very difficult to follow your paper. And then writing a paper without serious effort for revision, I think that is something that we really need to put at least 3 to 5 times of revising our own papers before we submit to any journal. And definitely, when we write, we need to know who is our target audience. I think it's very important because we are the authors and the other sides are readers. And definitely, at the end of the day, we aim to publish. And in this sense, journal acts as a bridge to connect our writing with the reader. So be careful with that, because when we write, we need to know the target audience. And then the other important element is to logically linking our ideas. So I think these are 4 basic key questions for us to ask ourselves for the sake of reader. So the first is why this paper needs to be written. I think we need to be very clear why. Otherwise, do not start writing, because it's quite difficult for us to maneuver later on. What we did. So there is something that what we did, what we found, and then how will this paper advance or contribute to the field. And if you're looking at the usual scientific writing, so basically why this paper needs to be written will be introduced in the topic, or usually in the introduction chapter, introduction section. So I think there is something that we need to clarify why this paper needs to be written into what is currently published, what's problem in the topic, and then at the end of the day, what this paper will offer to the reader. So I think this is quite important. And we talk about what we did. So basically it's methodology. And this is depending on the types of article that you are submitted. If original article, then you have methodology. But if let's say commentary or letter to editor, maybe methodology will be not so much relevant in that format. And what you found basically in your results, particularly if you do research, original research, then you have to summarize your result in figures, tables, and many other forms that will facilitate readers' understanding about our findings. So that is what we found. And then how will this paper advance? So basically in the discussion, and perhaps there will be a subsection under discussion, the implication of the study to advance the field. I think this is something that we really, really think about when we are putting our ideas in the paper, in the scientific paper particularly. Okay, so it's a basic. And then in terms of writing style, I think if you are looking at cognitive load theory, the proposal is not to go beyond than 20 words per sentence, because based on the research, you say that 20, the comprehension ability of our reader is about 80%. And if 10 is 95%. So our aim should be, okay, to ensure that per sentence, when we write our papers, so 10 to 20 words is our aim per sentence, and then one idea per sentence. So this is very basic, rules for any writers when you are writing your paper. So keep in mind, 10 to 20 words per sentence, one idea per sentence, and you will do something wonderful in your paper. And then definitely, when we write, we start, particularly if you are a beginner. So this is something that is very common, which is writer's block. So and we found that many beginner writers, especially, suffer from writer's block. They find it difficult to start. So what will be the rule of thumb when we want to get started? So basically, it's about our right brain. Just write it. That's as simple. Don't worry about spelling or grammar, the idea, the connection. Don't worry about that at this initial stage. Just write whatever you have in your mind. Because afterward, after some time, when you have done the writing, basically the left brain will take over and we're getting everything organized. So basically, when we put ourselves in the initial stage, we just write everything what we have in our mind. You will surprise that how much ideas and how much words that we are able to produce within the short time. And then later on, after we have all those ideas, this is a time that we now begin to organize those ideas into logical sequence. So for anyone, okay, if you have this situation, just write. Don't worry about the grammar, the organization, the idea, the sequence. Later on, it will get organized automatically if we keep improving our writing. And then sometimes, not only writer's block, but sometimes even though we have put everything in order, sometimes we need to stand back, because if you imagine we are a mountain climber, so usually we want to see the overall picture, so we need to keep distance, at least 2 kilometers from the mountain, because we want to see which is the best route we want to go and to cross the mountain, isn't it? So in writing, the same principles, but the distance here is about time. So basically, if let's say you have something that already blocked your mind to write anything, just stand back for a while, maybe a few days or maybe a few weeks, and then come back to our writing with a fresh mind and fresh eyes to see, oh, okay, I can do better. Maybe I can change this structure like this. I can change that, and so many things. And I used to do this. I used to do this. Sometimes I keep my unfinished papers in my folder, and then I keep for mine. And I come back. Yeah, definitely, it's amazing. You can see that. Oh, why shouldn't I do this way? In ensuring that we communicate the ideas clearly to the reader. So this is something that I did, and perhaps you can do as well in scientific writing. And then the other thing, once you have the draft, it's always good to talk about our writing with other people, particularly those who are not in our field. Can they understand what we wrote? So I think there is something good way of practice as well for us to get some idea from others, so that we can improve our writing. And then once you have done, please read our own writing. So this is something that we need to be fair to readers. So we need to read our writing first before we send to any journal, and even before we publish it. So reading our text is actually the best way of checking how much understanding that we can have based on our writing at that moment. If ourselves could not understand the writing, So what do you think? What do you expect from the readers? Okay. And writing effective titles, I think this I took it from the Springer Nature um, uh, tips. Basically, in any title, you should include one is the variables, outcomes, and sample. Example, let me give examples. Okay, this is from the Nature Genetics. So if you are looking at this title now, okay, the first thing is the variable of condition, PGBD5, you know, and then measured outcome is site-specific oncogenic mutation, site-specific oncogenic mutation. This is outcome. And in terms of sample, is human tumor. So you can see that's very short, straightforward, but very easy to understand and published in Nature Genetics. So you can use this technique, variable outcome sample, as you know, putting your titles in an effective way. So I think it's quite important for any for any paper that you produce to have a good title yet effective, you know, to attract people to read. And definitely, when we have the paper, you want to submit to somewhere, so definitely there will be a challenge. But nowadays, if you use the free online journal selector tool, example here, Journal Guide, you can put your title and you put your abstract, and then just search. Then the journal selector will propose to you what are the suitable journals that fit with your paper. So based on your title and abstract, but you need to produce the title and abstract first in order for you to use this journal finder. And definitely, at the end of the day, we want to publish, but our goal is not to publish in the journal with the highest impact factor, but to publish in the journal that will increase our impact in the field. So select journal properly. So final note from me, because it's quite short time for me to have. Okay, so one is scientific writing is the journey, so it's ongoing process. We need to keep practicing because practice makes perfect, isn't it? And the second one is planning is the key. Definitely when we write our scientific writing paper, so definitely the planning is is really matter to ensure that the ideas will flow and communicate to the readers well. And then talk and getting feedback from colleagues, from relevant people will improve our writing very much. Okay, so I think that's the first session of me. It's about 10 minutes. So yeah, I maybe hand over back to the host.
Thank you so much, Prof. That is a very short and concise talk that you have delivered there. I would like to bid a welcome to all our 126 viewers now. So currently we are still in the initial phase of the webinar. We have started with Prof. Saiful, who has delivered talk about the introduction to scientific writing. And I noticed that one of the most practical tip that Prof has shared earlier is that just start writing, because I graduated from my PhD study in June last year, and I definitely can relate how when I start writing, I keep I stuck at one sentence just because I was trying to get that sentence perfect, and the progress is really slow. Therefore, just to write and then organize the writing style and all the grammars later, I think that is a very good tip there. Prof has also talked about how the journals is actually the bridge between us, the author, and also the readers. And inshallah, later today in the 5th session, we have Dr. Nurhanis, which will brief us about the submission of our articles to the journals. And let's see if we do have any question there in Facebook.
Yeah, any question? I'm willing to to take it.
Yep, looking here. Okay, I don't think we have any question for you now, Prof. But
okay,
definitely, hopefully, let's continue first with the second session, which is the knowledge, attitude, and practice study. So please, Prof.
Okay, let me share my screen again. Okay, this is my the second part of my presentation. I already briefed with the introduction to scientific. I think this topic will further, will further enhance our understanding about scientific writing with examples. Okay, so KAP study is basically knowledge, attitude, and practice study. Now, what is KAP study? So we need to know that KAP study is about the collection of information of what is known in terms of knowledge, belief, attitude, and what is done. The practice in relation to a particular topics in a specific population. I think there is something that is a basic definition what is KAP study. So basically, we are interested to know what the population is already know about something. What the belief that they have toward that topic and what their actions toward the topic basically. So this is quite interesting topic. And then why we why quite many choose KAP study, because one is reasonably easy to design, definitely conduct, analyze, interpret. I think there's one of the biggest advantage of KAP study if you want to do it, because it's relatively easier as compared to other research design. So, and then at the end of the day, the benefit is it provides valuable information for resource allocation in certain implementation, particularly in public health program. And if you're looking at important reason for conducting KAP study, these are the four main reasons why we want to conduct KAP study. One is basically to identify the baseline knowledge, misconception, attitudes, belief, in relation to any specific topic. So I think it's quite, it's quite basic and quite important before we implement anything. And then the second one is basically our aim is to understand and trying to communicate about topic or situation of interest across the field. So this is kind of important study. And then definitely the third one is about to provide information of needs, issue, or barriers, because when we do KAP study, we can identify all this information, and it's very good basically to ensure that what we want to deliver to the community in particular, that our target population will be more effective and reasonably able to communicate in less challenges and less issues. And then definitely people are using KAP study to measure effectiveness of intervention as well. So these are the important reasons for KAP survey or studies. And when we do KAP study, so basically we understand the level of knowledge, attitude, and practice that more efficient process can be implemented. And let me describe here is knowledge refer to understanding of any given topic. It means that we are trying to measure how much or we call it what is the level of understanding of our target population. So basically, it's about knowledge, understanding. And then if we're talking about attitude, basically it's referred to feelings or belief toward any given topic. So basically, we want to see what would be the preconceived ideas of our target population toward the topic. So this is quite important. And then the last is basically the practice, because we want to see the ways or their actions they demonstrate regarding the topic that we are introducing to them. So, or maybe the topic of concern that we are interested to study. So basically, there are three different constructs. There are different domains that we are exploring through KAP study. So I hope this simple illustration will give you a good understanding what KAP is all about. And then how to do KAP study. So basically there are 6 steps to do KAP study. So the first step, define the survey objective. Later on I will go one by one this step through examples, and then I will just narrate first what is the step. They have 6. And then define survey objective is very important. Then we develop survey protocol. Later on I will show you. Design the survey questionnaire, and definitely questionnaire construction is super important in this KAP. Conduct KAP survey, analyze data, and use the data. Basically how we can translate findings into action, and then how can we disseminate those data to the readers. Okay, now let's exploring the steps through these 2, I think, quite interesting articles in BMC Public Health, and the other one is PLOS One. The one is about hepatitis B, and then the other one is about COVID, which is the current one. And the COVID is conducted by UKM, Universiti Kebangsaan Malaysia, and then the other one is from the international school. And you can see, even though they are in two different settings, but more or less in terms of their technique, the steps will be similar. Okay, let us explore. The first step, as I mentioned just now, define the survey objective. If you can read my underlined sentence, let's go to the hepatitis B paper. The study aims to evaluate knowledge, attitude, and practice toward hepatitis among healthy population of Quetta City, Pakistan. Okay, and then let's look at the Malaysian study. The aim of the study was to determine the knowledge levels, attitudes, practice toward COVID among the Malaysian public. You can see that their survey objective were very clear. So basically, there is something that we really need to establish before we start our KAP study. And definitely, in order to define the survey objective, we need to review existing information. That is, in any research, we need to read the literatures available in a lot of databases. And then we need to determine the purpose of survey. I think this is an example of the purpose of survey. And then identify area of inquiry. You can see that area of inquiry. You can see, is it hepatitis B? Is it COVID in Malaysia or in Pakistan? So depend. Identify the survey population. Yes, Quetta City population, and this one is Malaysian public. And then creating a sampling plan later on. And then step 2 is about to develop the survey protocol. And yeah, the basic survey protocol is what is the study design, and most are basically cross-sectional. Okay, and then what are the study samples? So if here, for example, here the sample is about 1,000 respondents, and here is about 3,640. But definitely depending on your sample size calculation. So basically, is a kind of a protocol. And then, is there any ethical approval required? I think most of research require ethical approval. So don't forget, even though it's KAP study, but please submit for ethical application. And later on in the protocol, okay, you have designed the survey questionnaire. So basically, these are examples of questionnaire that was constructed from the hepatitis B research just now. See? You can construct in question, and the participant just answer yes or no. Okay, yes or no. And then each correct answer will be given 1, I mean that's score 1, and incorrect answer will be given 0. So basically, when you have 1, 0, 1, 0, just calculate and you can total up or maybe sum up the total score for the knowledge. And similarly, if you are looking at the COVID study about knowledge, even though if you notice that Pakistan used in the question form, but for the Malaysian, it's used as statement. So you can choose either want to go for statement or maybe in the question form. So basically, in the statement, true, false, I'm sure, I'm not sure. True, false, I'm not sure. But at the end of the day, the correct answer will be given 1. Incorrect answer will be given 0. So basically, there is something that the common practice in knowledge domain. And definitely in the study instrument, we need to ensure that we identify what are the domains that related to our questionnaire. And definitely the demographics, definitely I think demographic is depending on literature. What are the significant demographic that you think that will have effect on the knowledge, attitudes, and practice? And the rest is about knowledge, attitude, and practice relevant to the topic, similar to the hepatitis just now. This is an example of knowledge. And then the example of attitude. So this one is from the BMC Public Health related to hepatitis B. You can see that, do you think you can get hepatitis B? Yes, no. So how do you score? Basically, positive attitude will give 1. Okay, that's how you define a positive attitude, is depending on your question as well as the topic that you are research. And then this one, for example, do you think you can get hepatitis B? Yes. Positive attitude when they say yes. So this answer you can give here as 1. Those answer with no, we consider as 0. So this is how we put the score for attitude. Okay, similarly to this, but they presented in a different way because I do not have access to, to the real questionnaire. But basically, they ask in the question form: do you agree that COVID-19 will be successfully controlled? So basically, those with positive attitude will be given 1. Okay, and then those with negative attitude will be given 0. So the scoring is depending on the research team who developed the survey. So basically, you need to define clearly the scoring system. And in terms of practice, have you done screening for hepatitis B? This is a kind of practice. So positive practice will be given 1, and then negative practice will be given 0. So similar. So, and how do you know that positive and negative? You need to ask the expert. Have you done screening for hepatitis? Yes, definitely is positive practice. So that's depending on how do you construct that on, but need to be spelled out clearly. Similarly, in terms of the practice of participants on COVID-19, in the week before the MCO, did you avoid going crowded places such as wedding? If yes, then give 1. No, give 0, because at the end of the day, you need to put as a score for practice, for knowledge, as well as for attitude. So 1, 0. So the more the positive score, it means that positive, and less score mean that negative attitude or practice. And then when we talk about construct questionnaire, you have to set clear aim, define the attributes, write a plan, develop and writing item properly. You need to select item that really represent the domain or the attribute that you are measuring, and then you have to make standardization. Just now the scoring, positive, negative, you need to be very clear, and final preparation before we conduct the KAP study. This is just an overview of the 7 steps to construct questionnaire for any research. And then once we have finalized, finalized the KAP survey, now it's time to conduct the survey, and definitely conduct survey, you just collect data as it is, just determine the dates, timeline, recruit, and then train your supervisor, interviewer, if let's say it's about the guided survey, and then ensure that everything is in order. So that's basically data collection. And step 5, analyze the data. Definitely, once you have the data, you need to put into SPSS, Excel, or Stata, whatever whatever software, analysis software that you available to you. So basically, analysis data you can get someone help if you are not familiar with. And at the end of the day, the step 6 is about communicating your results. Translating finding into action if you are developing program. Write survey report, because sometimes you need to report the survey to the authorities or maybe to someone, and at least you want to disseminate findings through publication. For example, the article that I'm showing you here. And then at the end of the day, the most important is we want to use the data to help in designing our program that we are aiming to improve any misconception about the topic that we have studied. So in summary, I think when we talk about KAP, 1 is it must fit purpose. Definitely, KAP study require clear reason to be carried out. Specific topic, so you need to ensure what topic you want to cover in terms of KAP. You cannot study every topic, everything. Multiple topic is very difficult for KAP. Questionnaire must be constructed based on the base guideline, at least the 7 steps that I showed you. And then KAP guidelines is available for you to to refer, so that you can carry out KAP study in a better way. I think that's all from me. That's a brief summary about KAP study that I can share at this moment. Thank you.
Thank you so much, Prof. That is a brilliant presentation from you. We learned about all the 6 steps of doing a KAP study. And we have some questions here, Prof. First is from Muhammad Ikhwan Shukri. Does perception of the respondents is identical to attitude of the respondents?
Okay, so thank you so much for the question. Basically, by definition, they are different. You know, by definition, they are different because if perception is about how they perceive something, so attitude is their belief as well as a feeling towards something. But definitely, in measuring their attitude, we use their perception. Okay, we use the perception, so we call it perceive evaluation about themselves towards something that we are interested to measure. For example, the attitude, knowledge, and practice just now. Yeah.
Thank you, Prof. So let's move on to the next question from Ni Ahmad Khairul Fahmi. Can we do separate research, example, knowledge and study without the other two elements, the attitude and the practice? Can we do that,
Definitely
Prof?
you can, but it kind of, you have to do a multiple research. Why don't you do it at once rather than you have a few more research if you like to see attitude and practice? Yeah, definitely can. But if you to be efficient and to see the correlation between their knowledge, attitude, and practice, then you need to do it at once.
Understood, Prof. Thank you, Prof. Yeah. Let's move on to the next question. Do we have the third question here? I think we have another question from Picolas Four. Good morning, Prof. Regarding the questionnaire design, any importance to include not sure as an option since it will be classified as wrong answer? And
okay, will it give similar result? Okay, so now there are quite numbers of thoughts about this, but maybe I would put it a simple way. So basically, why people put a not sure, because they want to include the ambiguous wrong answer. You know, so they want to be definite. If let's say definite, we just put the true false, and they will exclude the not sure. So we can see that how many people are confidently wrong or confidently right, but the not sure whether they are not very sure, maybe they are not so so confident in answering this question. So sometimes we want to see which one is the best, that is the definite wrong or definite right. Then we exclude in the analysis about not sure. Then we make comparison. Is there any difference between their knowledge when we exclude the not sure and we include the not sure in the analysis later on? Yeah, there are certain researchers who like to be definitive in their do not know or they know. Yeah, something like that.
Thank you, Prof. So hopefully that answers Picolas' question. Do we have a next question here? Oh yes, another question from from Farina Hana. Assalamualaikum, Prof. How do we determine the scoring of attitude? Because some questions may be quite subjective. This is more on the design of the questionnaire.
Yeah. Definitely, in terms of the scoring, maybe you can use always you can use a percentile, range percentile technique, because there are many techniques to determine the score. You know, you have the percentile technique, you can use the z-score as a standardization. You can always use the upper, lower, and below. I mean that upper 30%, below 30%, in the middle would be the average. For example, let's say you have a 10 question of attitude question. For example, 10. Okay, 10 question. And then if let's say you decided to follow the 30% upper as high, it means that 7 and above will be high score. And then if you decide 30% and below will be the low score, so anyone with less than 3 and below will be low score, and in between will be the average. So that is the simplest way to score your attitude. Okay, so because each item will have positive attitude and negative attitude, isn't it? So when you calculate, for example, item 1 is positive, item 2 is negative, so 1, 0, and then later on 1, 0, 0, 1, 1, 0, something like that. You add on and you get the score, and then compare with the standard that you have decided earlier, which is anything less than 3 and below will be poor. If let's say the candidate that participant have 6 score, it means that is considered as average score. So that is the simplest way of put it the scoring system. Yeah.
Thank you so much, Prof. Let's move on to the next question from Alia Azwa. Can we construct multiple choice questions in KAP study?
Yes, definitely. Why not? Because it's assessing the knowledge, and even better. But it will be like exam. If you put the MCQ. So if you do not like the exam, definitely our participants do not like exam as well. So that's why the simplest is just use true false. Example just now, true false answer. That will be better. That will be better because it's easier and simpler to develop, and then it's easier and simpler for respondent to respond. So that's why from my experience and reading the papers, rarely I see people use MCQ. The choice they have to make a choice A, B, C, D, and in fact, true false is part of the MCQ as well, just a different type.
Thank you, Prof. I can relate when you say that when it is a dichotomous option, it is easier for the respondent
Yeah, easier for respondent to respond. Yeah, definitely.
Yes. Prof, we have another question here. In KAP study, do we need to use validated question?
Yeah, definitely. In any study, we need to use validated question, but the level of validation will be different. Because in validation, we have 5 different levels. One is at least at content validation. It's at least at the content validation. It means that we validate the content through expert. So at least the minimum of now for the validated question, at least content expert. But if you go further, it's good to have the response process, audit phase validity, and the internal consistency and internal structure validation, and many more. That is there's higher level of validation. But for KAP, so far I think if you can get the content validity and phase validity, that will be enough. That will be enough. And you can always do the post hoc analysis to see the reliability of the KAP survey that you have developed. Yeah.
Okay. Thank you very much, Prof. I think that that is the last question that we're going to answer in this session today. But then for all the questions that we may not be able to show it here today, the question will stay in the Facebook page, and hopefully you can get the answer when our panelist Prof may answer it on the reply to your comment in the Facebook page, or you can email Prof if you need further information. So now let's move on to the third session today, which is another branch of medical research that you can do, which is case report made easy. So this is basically on how to start doing and writing a case report. Our speaker today is Associate Professor Dr. Wan Alia Wan Sulaiman, which is a consultant neurologist and physician from the Department of Neurology from University Putra, Malaysia. So Associate Prof. Dr. Wan Alia is a graduated from RCSI in 2009 and has also graduated from the Master of Research in Clinical Science with distinction in 2016, and she also holds the MRCP UK and also has undergone a subspecialty training in neurology in 2017. Dr. Wan Alia has written about 28 articles and 16 proceedings and has been involved in at least 11 research projects. So let's hear from Dr. Wan Alia herself on how to write and how to conduct and also how to write a case report. So we're gonna share the screen. Sorry now, there's some technical issue here. I'm not able to share my screen. Let me see if we can do, give me some time to sort this out. All right. Okay.
Assalamualaikum warahmatullahi wabarakatuh, and hello to everyone. Thank you for joining this seminar today. I'm Dr. Wan Alia from Faculty of Medicine, UPM, and today I'm very honored to share some simple tips to help you write your very own first case reports. I will explain the brief overview and the steps required along with some examples from good case reports published as our guidance. What's a case report actually? Case reports are a time-honored tradition in the medical profession which dated back to 3,000 years ago since ancient Egyptian medicine, which was later translated by Dr. Edwin Smith in the 19th century. In our modern day, physicians of all specialties have described interesting cases. Published case reports provide important scientific observations that are missed or undetected in the clinical trials. So the act of recording discussion with colleagues and publishing our clinical observations with patients remain important to the art of medicine and patient care. We as clinicians should be proud that we are entitled to write one. In terms of the level of evidence, case report has the lowest hierarchy since there's no study design involved and is prone to reporting bias. However, in view of the spirit of the traditional medicine as well as a practical way for us clinicians to convey short messages, case report can be powerful and instructional. Therefore, case reports are made compulsory for undergraduate and MAC courses in Malaysia. Common scenario for us is that we don't know where to start and how to go about it. So we try to keep things as simple as possible and make it clear by explaining it in a step-by-step approach consisting of these 5 simple steps. First step is actually to find a good case to write. Sometimes you'll find lots of interesting cases in the wards and in the clinics, but we're not sure whether the cases are worth writing or reporting. So these are the points that you should consider. So first, whether the case is unique. So for example, this case that has been published in 1981 is quite unique. So they reported cases of extensive disseminated Kaposi sarcoma, which led to the subsequent discovery of AIDS disease. Or whether the case has unusual presentation. So this is the case of tophaceous gout of the atlantoaxial joint, which is quite a rare presentations of gout. Or it could be an unusual combinations of conditions. So our colleague here recently published arthritis as an initial presentation of malignancy. Or it could be unexpected response to treatment. So for example, this case infected aneurysm secondary to a long-term arterial catheter. So you should consider all these to decide for your case. Step 2, once we have identified our case, the next step is to prepare on the write-ups. Before writing, we need to strategize early by getting the patient's consent beforehand because most of the journal required patient's consent upon submissions. Next is to get all the information required about the case, to get the clinical history from the medical records, get the results and investigations, but remember not to disclose any information that might reveal the identity of the patient. Be particularly careful with the pictures that might reveal the face of the patient. Last is to make sure that you follow up the patient's progress, especially if you encounter the patient in the ward, and make sure that you know the final clinical outcome. Step 3, after completing your pre-writing preparation, the next step is actually sit down and write, which from our own experience is the most difficult step for us. So we need to find a dedicated quiet time away from distraction to write. In general, all case reports include the following components: the title, abstract, introduction, case, discussion, and conclusion. Now let's discuss the press text of writing the actual case report by going through the individual sections. So how do you write a good title? Although title is the first sequence, but usually the best is to keep this to the last. So title must be clear and descriptive, stating what is the disease and what is the underrepresentation. And we can usually end the title with a case report or 2 case reports or a case series. We should avoid abbreviations in the title or any bombastic wording within the title itself, and try to keep things strictly informative and as simple as possible. The title needs to accurately describe the case. After all, this is the only time that you have the opportunity for someone to decide whether they want to read your case report or not. Next is the abstract. I find this is the most important part because this is often all that people will read, and it helps the readers decide their level of interest in the case report. The abstract should be a concise and condensed version of the case report, and it should include the same main sections of the main text and be as succinct as possible. This is the last thing that I usually write, as it tends to flow easily after I have invested my time in thought and writing of the. Let's see some example of abstract as shown here. So in general, it should be a short paragraph consisting of about 100 to 300 words. The paragraph could be something like unstructured, such as on the left side, you can see the gastric perforation secondary to the Rapunzel syndrome here. Or it could be a structured paragraph. For example, in this case report of a combined venous arterial thrombosis in MPN in a young patient. So which they divided it into background, case presentation, and conclusion within the abstract itself. The main thing is the focus should be highlighted with essential information, ended with the teaching points as illustrated here. For example, in the gastric perforation secondary to Rapunzel syndrome, so they highlighted that through uncommon, the results should be included in our differential diagnosis of gastric perforation. So that is the teaching points that ended the paragraph. Introduction gives a brief overview of the problem that the case addressed. Clearly explain the background of the topic, cite the relevant literature where necessary. The introduction or background serves as the sales pitch for the rest of your manuscript. So it should be concise and it should be salient in the points and immediately attract the reader's attention to entice them to read further. So this is to show an example of an attractive background or introduction. So why is it worth reading? So the authors outline that the MSU crystal deposition in the spinal joints are rare, and this will attract the reader's attention upon reading this. And then the author subsequently provide explanation of the disease in line with the previous literature. As you can see here, lots of reference were included. Right, next is the case. So case is one of the most integral sections in the manuscript. So the case should be describing in a concise and chronological order as depicted here on how should you report the case. So we should begin with the primary complaint and followed by the salient history, and this include all the significant family, occupational and other social history, along with other significant medications taken or any allergies. So this history should be followed by the physical examination, starting with the vital signs presented at the examination of the patient, along with the pertinent investigations and results. There should be enough detail, but not too much, for the reader to establish their own conclusion about the validity of your case. So as you can see here, the example of a good case description outlining the pertinent information of a case of gout in the spinal joints, all right? So nicely, they have started with demographic details followed by the history and the physical exams, and nothing unnecessary or confusing in this case. So they included a serial blood test as well as a clear neuroradiology images. So just to share on some simple tips about how to describe the cases. So always preserve patients' confidentiality. Please make sure that you don't put the real names, the MRN number, and the IC number in the case. And you present again in a chronological order so that readers won't be confused of the timeline of your case. And please include important negative findings as well as important table and figures, but they needed to be brief and with a clear description. So if you have an interesting HPE or full blood picture, you can provide the picture and as well as the comprehensive report of the pathologist. So in summary, you as an author should ensure that all the relevant details are included and all the unnecessary ones are being excluded. So keep things as simple. Again, in this slide, I'd like to show some examples of investigations included in the case. So this is a very nice ECG included, all right, with a coronary angiogram, MRI, as well as the some blood parameters. So once you have present your case, then discussion is the most important part of the case report. So the part that will convince the journal either the case is publication worthy or not. So this section should start by expanding on what has been said in the introduction, focusing on why the case is noteworthy and the problem that is addressed and the message that the case conveys. This is followed by a summary of the existing literature on the topic. This part describes the existing theories and research findings on the key issue in the patient's condition. So the review should narrow down to the source of confusion or the main challenge in the case. And finally, the case report should be connected to the existing literature, and please discuss the current literature in light of the current case and state any limitations of the case. So the author should also explain whether this corroborates with or detracts from current beliefs about the problem and how this evidence can add value to the future clinical practice. Now, let's look at this case report. Again, how did the author do it nicely? So the significance of the spinal gout is stated here as is one of the differential diagnoses in myelopathies. And they explain that the key findings are in relation with the EULAR diagnosis score of 15. And overview of the spinal gout treatment is also explained here. And the author had stated the limitation of the case, whereby they said that they did not obtain any tissue samples. So they have provided all the important information for the discussion. The last but not least is the conclusion. So a case report ends with conclusions, and this section should briefly give readers the key points covered in the case report. So conclusion should be short and concise with a clear take-home messages and teaching points. We should give suggestions of advancements of knowledge or recommendations of any important clinical practice derived from your case. Now let's look at a good example of conclusion from the case report that we have discussed earlier. So the author has briefly summarized the case in their conclusion. So they said that spinal gout are more common than previously thought, and they put important lessons learned from the case where they emphasize that spinal gout should be included as the differential diagnosis in myelopathies, and they put recommendations of treatment for spinal gout. So they emphasize that medical therapy should be first line. So it's very concise and straight to the point conclusions. So how about your reference? The reference listed at the end of the case report after the conclusion should be carefully chosen by the virtue of their relevance. So reference should provide additional information for readers interested in more detail than they could find in your case report, and they should support any specific points highlighted in your case. Some journals restrict the number of references to not more than 20 or 25 for a case report. So keep it things simple. So what happened next once you completed your write-up, which is the most difficult process? So next, step 4, you should send your manuscript for a proofreading. First, in terms of the intellectual content itself, so get help, get input from the other co-authors, from the senior members, from your supervisors. And then secondly, in terms of the language, so if possible, get help by a professional English editing service to proofread your grammar and English structures. Right, step 5, the final step is to get your case published. So I don't have much time to explain in details, but in general, first you should know how to find suitable journals for your manuscript or case, and always be aware of regulatory journals nowadays. Try to send to citation index journal and check the article processing charges, right? And different journals have a slightly different formatting for case report. So it's always a good idea for you to read some of the target journal first before writing, and to get a general idea of the instruction for authors. So know your word limits and know your citations and the format of referencing. Alright, so last but not least, for MEd students out there, so every university has their own assessment form for the case reports. So here I would like to show you an example from the MEd Medical UPM, whereby you can see that 60% of the marks are based on the case discussion and the literature review search. So in summary, know your 5 simple steps of writing a good case report. So first, choose your case. Second, prepare before writing. Third is write properly according to the technical requirements. 4, proofread. And 5 is to publish your case. So make sure that your case is unique, rare, or unusual, and the manuscript is short, and make sure that you have a clear learning point and recommendations from your case. So with that, thank you so much, and I hope you will enjoy writing. And just think that it's just another documentations of your medical record, and I can be reached at wanalia@upm.edu.my should you have any queries or you want to write with me. Thank you so much.
Thank you so much, Dr. Wan Alia. So actually that is the pre-recorded talk by Dr. Alia that I shared earlier, but we also have Dr. Alia in person here to answer any question. So let's see if we have any question from the viewers. Before that, I would like to bid a welcome again to all the 134 viewers of the HOT webinar series for today. Okay, we have one question here, Dr. Alia, from Minaga Kalyana Sundaram. Such a beautiful presentation, to the point and precise. Okay.
Thank you, Dr. Sundaram.
Okay. I actually have a question for Dr. Alia. Doctor, in terms of writing a case report, do we need to apply for any ethical committee approval first?
Yeah, that's a very good question, because I mean, currently all the authors keep asking that. So actually, I am part of the ethical committee in the UPM, and so far I'm not sure whether other ethical institution have different requirements, but I think in general, case report, I mean, the ethical committee it's not required. So it's just a patient's consent that is required, but the author does not have to send applications to the ethical committee. But I think there's some recommendations to get permission from the director of the hospital. That also depends on your local hospital. So maybe you can ask around about that. So basically, to the question, yeah, no ethical approval is required for case reports.
Thank you, Dr. Alia. We have a question from the admin of the HOT, him or herself here. Is there a limit for the numbers of authorship in publishing a case report?
All right, so this is a very sensitive question, I would say, because usually there are 2 schools of thoughts regarding authorship. All right, so the first school of thoughts is to restrict authorship only to those that contribute academically to the case, And second school of thoughts, I mean, you can include those attending doctors that have helped the patient's care, throughout the patient's process. So, but the right answer is actually to check the journal's requirement, because some journals, they put limitations for the authorship. And my personal opinion, you can, I think it's nice to include all the doctors as much as possible up to the journal's requirement, because sometimes, they all we put all our effort, but in different way maybe. So it's just, saying, okay, thank you for the doctor's contributions towards the patient's care. So that's my opinion.
Thank you, Doctor. We have another question here from MDS. Not sure if Mr. or Mrs. or Doctor. Hi, Doctor. For discussion, can it be author's opinion, or should we quote previous publication?
Yes, this is very important question. So that this is the specialty of the case report. So we as clinician and we as doctors, we are entitled to give our own opinion regarding the case. So we can put our own opinion in discussion, but not in the case itself. And of course, if we have some evidence of other publication to support our opinions, then we can put previous publication to support our opinion. But if we don't have, then our opinion alone is enough actually. So that's the uniqueness of the case report.
Thank you, Doctor, because you did mention that it is a privilege for the clinicians to actually publish a case report. We have another question from Azura Haji Abdullah. Is it feasible to conduct a non-clinical case report, such as based on the retrospective data per se?
I think this would be like something like audit. Yeah. So this would be, in terms of design, this would fall into under retrospective studies. So it's not a case report per se. So case report is yes, it's actually retrospective, but it's a single case or two cases, or you can have case series. So I'm not sure what does the non-clinical means, but usually it's a clinical case report.
Thank you, Doctor. Yeah, so if we are looking at the audit design of research, we hopefully we can conduct another webinar on how to conduct an audit for the medical research. We have another question here from Zika Junaidi. Hi, Dr. Wan Alia. May I know how many minimum cases are considered as a case series, and also the consent that we obtain from the patients, is it verbal, or we have to prepare a special written consent to publish the case report regarding the patient's case? And thank you for the concise presentation as well.
Okay, thank you, Zika, for the question. So again, it depends on the journal, but I think in general, some journals as minimum as 2, you can consider case series, but usually it's 4 to 5. And consent-wise, yes, you should ask verbally at first, but usually you need to prepare a special written consent. So some journals provide the template. You can just download from the journals, or you can just do generic ones for the patient. So, yeah, I think that's it.
Thank you, Dr. Alia. I have another question regarding the patient's consent to publish case report. Do we need to obtain the consent form from the journal that we're planning to submit, or can we use the general consent form from our hospital template? This is from Rizwan Due.
Yeah, I think similar from the previous question. So it depends on the journal. So if they specify that you must use their own template, then please use their template. But if they did not put any specification regarding the informed consent, it's best for you to prepare beforehand your own consent from the hospital template. So that's because sometimes some journals did not ask on submissions, but after publication, then suddenly they will email you and ask for the consent. So it will save you a headache. So better for you to prepare beforehand. Yeah.
Thank you, Doctor. I think that's all the questions for our session today. I would like to say thank you so much, Dr. Alia, for the wonderful presentation, as well as being here today just to address us and really educate us on how to write a case report. Thank you so much.
Thank
So,
you, Fatih. All right.
Thank you, Dr.
Okay.
Alia. All right, then let's move on to our third speaker today. Our third speaker today is Dr. Anissa Abdul Rashid. Dr. Anissa is currently a family medicine specialist in University Putra Malaysia, and she is also the head of research of the Islamic Medical Association Malaysia, or IMAM. And Dr. Anissa has written about 22 journal articles and also 19 proceedings, and has been involved in at least 6 projects. She is also a reviewer for various journals, including BMC Public Health and also BMC Family Practice. So Dr. Anissa today will talk about the how to write original articles. So we have heard about the KAP study from Prof. Saiful Bahri. We have heard about the case report, and now from Dr. Alia earlier, and now we are looking at about how to write the original article. So Dr. Anissa, please.
Assalamualaikum. Thank you very much to Fatin for the kind introduction. I'm just going to share my screen here. Let me know if you can see it.
Yes, Doctor, we can see your screen.
Okay. All right. So thank you very much to the organizers, I must say, for this very kind, very important topic. And I noticed that the topic is Introduction to Medical Research. So I focus because I think it's a very big topic. Original article is like any study in the whole wide world that you can publish and how to publish. So, and I do understand that publication, even among the senior doctors, even among those that have been in universities or in hospitals, is very intimidating. I understand, and it was very intimidating for me as well when I first started. So, the topic of my presentation is tips and tricks. Yeah. So writing specifically would depend on your articles, but what I hope to do is to get you in the mood, to get you into the mindset that everyone can publish and that it's possible. And if you can see here, I put a little like disclaimer there that I actually started publishing only a few years ago. So it's not impossible to do. And you are able to do it, okay? So before that, I just want to share with you guys what I do in my scope of work. I think there's a misconception among doctors that we in the universities, we have all the time in the world to do research, and we don't really have, it's different from people that actually practice in the clinic or in the hospitals. But actually, I just want to say that we do have our own clinic. We are clinicians. We work, like Dr. Alia is a neurologist, so she would be on call. We do see a lot of patients as well. We do work in the Ministry of Health setting. We were trained in the Ministry of Health setting for a couple of years. We did our housemanship there. Myself, I was trained in Klinik Kesihatan. I had to go to all those meetings in PKD and all that kind of thing. So I do understand if you think like it's something that you can't do, but it actually is okay. So, and I did locum a little bit on and off here and there. I don't do it anymore, but I used to. So I do understand those that work in the GP setting. I kind of understand the situation there. I'm also a medical lecturer. So what we do apart from teaching, from the clinics that we go, we teach as well, and we teach our undergraduates to do research as well. We teach MMed, Masters of Medicine in Family Medicine. They are also working full time. If you've seen them in the hospitals or in the clinics, they're actually working, and they also have to do research. And then parallel pathway like the FRA, CGP, they actually have to work as well. They are medical officers, but they do have to do research as well. So what I'm trying to say here is that people actually do research while working, so it's not impossible. Okay, and apart from that, number 3 here, I'm a health NGO activist. I'm part of a association, health association. I'm sure a lot of you as well are involved in this situation, and I actually am very proud or very happy to be doing research in terms of what my association does as well. So maybe I can get some ideas, inspire some of you to actually do research in your fields as well. And if you guys have heard of Medicorp or Medigrow, it's like a training company for junior doctors. So I've done research with them as well. So I mean, that's kind of things that you can go around that you can actually try and incorporate your research in terms of your work. Okay, right. So the tools, I think what's important is to know the tools, because I can't really go through one by one. In terms of original research, there's a lot, there's an array like KAP and that Prof. Saiful mentioned earlier on. That's just one of the things that you can do. But there's a whole array of kind of like research structure or research design that you can actually do in your setting, and that would be beneficial for the rest of the community. So examples that, but what's important, I think, is tools that you need to actually start. Okay, so number one is the right mindset. I think that's very important. I'll talk about that later on. Number two is persistence. Okay, so you may have ideas, you've got loads of ideas, but then actually writing it down and doing it, I think that's the biggest challenge of them all. And in Arabic, we say sabar or sab, or in Malay we say sabar. And actually sabr in Arabic means persistently doing it, slow but steady. So I think this is very important. You need to be patient in terms of that as well. Okay, you need to be passionate about the work, meaning that when I showed you my scope of work, it means that I'm fully involved in that scope of work, that I want to do the research in that. So if you have the right mindset and the right passion, it won't be impossible for you to do. Okay, next is having a mentor. Okay, so if you're doing research, if you're in a program, you do have a supervisor. But what I'm trying to say is, when I was doing my master's, I did have a supervisor, but after that I didn't have a supervisor. I kind of looked for somebody for me to look up to and ask questions. Okay, I think that's very important as well. So if you're in the hospital setting or if you're in the clinic setting, you're going to have a specialist, and that specialist must have done some sort of research before, and they can guide you. Okay, so I mean, do it within your own capacity, maybe discuss with them and see what's logic for you to do. Okay, you also need a motivated team. If you have 2 or 3 people doing the work with you, it's more feasible, but I'm not saying that you do have to have a team. I've seen people do with 2 or 3 people only, and that works. What's important is you have your mentor to guide you, to know what to do. Okay, and then this is kind of like adult learning, I would say. So learning from previous examples. What I mean to say is, if you want to do this kind of research, you look at other research. For example, Prof. Saiful mentioned the KAP. You look at the ones that's been done before, and you learn from that. Okay, so I mean, there's another way is you go for all these different conferences, you know, you go for all these lectures, and then you want to start writing. I feel like that's maybe half of the process. How I learned was, I learned through experience. Everything was, I looked, I tried, and I asked the right people. Okay, and the next one is probably reading up. You're going to be reading a lot of articles, so please don't read it when you're looking through articles to help you with your research. Please don't read it like a book. Read it. Is this relevant? You know, read. It's called. I call it targeted reading. See if it's relevant, and you may want to use that later on in your write-up and in your research. Okay. Next is time management. It's very important. I don't think anybody has a lot of time. Everybody's busy, wherever you are, whether you're married, you're not married, you have family, you don't have family. You're a clinician, you're a non-clinician, you're a doctor, you're not a doctor, everybody's busy. So it's always about thinking about putting in the time. And last but not least is always ready to learn. So, I mean, I'm still learning. I still ask a lot of questions. I think you have to be a bit humble in terms of looking at different points of views and then deciding on your own, okay? So that's the tools just now. I hope I didn't go too fast, but you may ask questions afterwards. I think Fatih maybe can just stop me if I'm going too fast, or if anybody doesn't understand, or if there's questions going on, that would help me as well. All right, okay, so now I showed you number one, the tools of the right mindset. I think this is the most important, because if you feel that it's impossible, you can't do it. I think that's what I get when I tell people about research. They think they can't do it, and then it just stops and they just give up. Okay, so I think this is the one tool that will keep you going, and it did keep me going. I graduated from my master's in 2015. It took me 3 years to actually publish my first research project. So the first step is always the hardest, and it doesn't have to be you publishing a lot. It's just you starting to publish. That would be something to motivate you. Okay, so the right mindset is critical thinking when you're doing work. Okay, so the HEART kind of NGO, the organizers actually did a questionnaire about those of you who are here today. and they kind of had their little kind of research, and actually if they went through the proper stages, they could have published a paper as well. So they told me that a lot of you are actually medical officers, junior medical officers, and you actually want to improve your knowledge. Okay, so with that information, I try and cater my talk to this group of people because the majority of you are there. I know there's a little part of you, a small majority that is a minority, sorry, that is actually medical students as well. So I kind of like think about that and try and use that information to present it to you in such a way. So that's kind of like the same concept that you're going to use when you want to do research and you want to publish later on. Okay, so as an MOH junior doctor, if you're working in the clinic, if you're working like in the hospitals, what kind of information that when you do research that's going to help you? That's very important. And that goes the same for NGO, non-governmental organization, your charity work, and also others if you have business or if you have personal issues. Okay, so when you get that information, when you're trying to practice, it's always evidence-based practice, because evidence practice makes you feel that you're giving the best that you can in terms of your management or whatever you're doing. You're giving the best to the patients, you're doing your best quality of work to the NGO when you have evidence. In fact, it goes back a couple of years ago or a few hundred years ago, even in religion, we use evidence-based. You know, there's certain things that we do because, you know, it's talked about, it's 1, 2, 3, 4, and we follow some kind of guidelines. So evidence-based practice is nothing new, but it helps us to improve in terms of quality of work. Right? So, okay, so for those of you who work in the hospital or in the clinic setting, what kind of things that you can do in terms of research? Okay, so I can imagine when you see patients, you're doing your ward rounds or you're doing your clinics every day, you see like a lot of cases, okay? And there's some things that are very clear, this is the management one by one by one. But then there's some things that you're really not sure why it's like that. And when you read up, it should be a habit that when you manage patients, and especially if it's a lot of them, you start asking questions. Why do you treat like this? And why is the management like this? And you start reading into it. And you kind of have some idea of things that maybe is not really talked about. And especially if we're in Malaysia, we're very unique. Even our clinic, we're very unique. We have a lot of different backgrounds of patients, and we want to know regarding our patients as opposed to the national guidelines maybe, or as opposed to international guidelines. So that's very important information to help us with management. So I wrote here that the data you can use, the data that you get from your research is supposed to help you with management. So if you think along that lines, you're really going to be invested in your research, okay? So again, at clinical setting, you can write case reports. So if you have unique cases, that's been taught by Prof. Alia earlier on. That's a good thing that's been covered as well. But there's another thing that you can do, which is data that you already have. I think one of the questions that was asked was about audit. Okay, so I know that you guys, if you're in clinic, a lot of you guys would be doing this audit. Now, it's not a research per se, but you can actually publish what you have, and you give like a scenario or information that's very important for other people that's in your area to compare with. So even just giving data like in the audit can be very helpful. All right, okay, so examples of data that you may have is probably a quick smoking clinic if you're in Klinik Kesihatan. So within 1 year, you know how many people are engaged in that, are in the clinic, and you know what are the kind of people that comes, are they successful, are they not? Even that kind of information is very good to publish as an original article. Okay, but I think the most famous one is probably the diabetic clinic, because a lot of you actually have to go through and look at the quality and how many people get 6.5, HbA1c, and things like that. And it's not just in the clinics, it's also in the hospitals. So I'm going to show you an example of that as well. Apart from what I've said just now, other things that you can do is what was mentioned earlier on by Prof. Saiful was KAP is a questionnaire, and it measures something. So I think in terms of research, questionnaire is very good as well. You can give questionnaires out to your patients, even to your colleagues, depending on your research question. Just make sure it's a good tool to measure what you want to measure. And that also is something that's publishable and can help in terms of publishing your research. Okay, I'm going to give you some examples that you can do, and you can start thinking about what you can write as an original article. I did this research when I was a master's student, which was done in, I think it was 2015 or something like that. So what I did was I looked into, so we have a lot of diabetes patients. I'm sure if you work in the hospital or in the clinic. And what I did was I gave out questionnaires that looked into social support. So one questionnaire measured social support, another one measured self-efficacy. So what is self-efficacy? It's how they perceive, how they feel about managing their own disease, such as type 2 diabetes. Basically, that's what it meant. So I wanted to see if they have good social support and how does that affect the way they manage their type 2 diabetes. So basically, I handed out questionnaires to the clinic, to the patients in the clinic, right? And being a master's student, I had like 3 months to do data collection, but not all the 3 months, just once a week. I did it on a Wednesday, and I collected patients from there. But if you do work in a busy clinic or hospital, you can get the help of your staff to, give them the criteria of the patients that you want, and they will start handing it out for you. Usually the sample size is not that big, 200, 300. If you do it every day, probably within a week, you can get your sample data. So it's not something that is impossible to do, okay? So in this project, I also did another project that looked into their social support and their self-efficacy. And I looked at the glucose level. So I had access to data to patients, so I could look at their results of social support and self-efficacy, and I looked in the data for the HbA1c level. This was a negative result, but as Prof. Saiful said earlier, the results here shows that even if it's negative, you can publish it and you can discuss it. And if you can see, my research group was only actually 4 people, and the previous one was only 3 people. So it can be done if you plan your time well. Okay, so this is one done by my colleague. It was quite a long time ago. It was done in 2005. This is a clinic audit of 2 KKs, Klinik Kesehatan, okay? So this can be done as well. You can publish your reports as well, meaning that you don't have to have questionnaires, you don't have to involve any human being or anything like that. You're just looking at data, okay? So let's have a look at what they reported in terms of results, okay? So they had 396 medical records, okay, were included, and most of the patients had fasting blood glucose and blood pressure recorded in more than 90% of the visits, okay? So they reported that, and that's very important for us. We need to know that, okay? And then 27% of the patients had HbA1c done every 6 months with a mean of 8.3%, okay? So you can see in terms of report, it's just reporting what you have in your clinic, but it's very, very important for clinicians, for researchers to know these numbers. And that is publishable as well, okay? Of course, you need a mentor to guide you through this. So it's something that you can think about doing as well. And since most of you are probably involved in it anyway, okay? That was in 2010. So I want to show you one recent publication that was done. What I did was I looked at what this article published, who cited this article, and I found one. And this was in 2017, okay? And they did an internal audit of diabetes care for type 2 diabetic patients in a public hospital. So for those of you working in hospital and not in clinic, you can still do this. And you can see that there's only one researcher. So this doctor did it all by themselves. But I guess, you probably need a mentor, so 2 people. But it's done, it can be done, okay? So here, they talk about, they went to 233 patients' records, and 79% did HbA1c, and only 25.8 had annual food screening. So I hope that you can see that this kind of thing is publishable and you can do, and this is considered original article. Okay? Right, take pause. Right, what else do? I do NGO work. You can scan this QR code to see what we do. It's the Islamic Medical Association of Malaysia. And I do a lot of, or I'm involved in a lot of reaching out to the communities as well. We are not, despite the name, it's open to all religions. You don't have to be a Muslim to be a member. Okay, so what did we do in terms of research? So in IMAM, we have a chapter called Imaret. I hope some of you have heard of Imaret. And Imaret does mobile clinics for Rohingya refugees. Before this was mobile because we used to travel to their place, like their community, and do our clinic. And this is kind of what it looks like. But now we have our own clinics, alhamdulillah, so they can actually go to the clinics there. But we wanted to know how good was the drugs used in diabetes in the clinic. And that's what we looked into. We did it it was a study that was done between August and November. And we looked into that, and we compared that. And there was a guidelines. We looked at the CPG, and we wanted to see if the doctors followed it. Okay, and we reported that. So if you're involved in something like this and you want to see or you want to report what you've done, it's a good way of having an original article as well. Okay, and we do mention our NGO as well, and we do mention the universities involved. So that's a good kind of like step for you to do as well. And this was recently published also, and this is us looking into antimicrobials used in pediatric patients in this clinic. So we found that albendazole was the most prescribed, for example, and age and BMI was significantly associated with infections. So, you know, that kind of information is very important. And it's something that you can publish as well. It's not impossible. It's not like very high-fi that you need to have an intervention, or you've heard of randomized control trials. And it can be something simple, but doable and publishable. Okay, so there's another project that Imam does. You can scan this for video. This is a QR code, which is called the Teddy Bear Hospitals, whereby the children would bring in their teddy bears and act like they're the parents of the teddy bears. And we would do like a toy hospital and set up, and then they would go and see the doctors. So what happens there is we want them to feel that they're not scared of the doctors there. So we do this so that children are less afraid of the clinical setting. So we do this, but we don't know if, like, is there any evidence that says that we do this is good for the kids? We're just doing it because other people are doing it, or it's been done in the UK and in other places. But actually, what we did is we wanted to look into whatever we practice, we wanted evidence. So we did something called a systematic review. Now, a systematic review is you searching on different databases of certain keywords relating to your topic of interest and looking at all the articles there. So we looked into Pretend Medical Play and Teddy Bear Hospital. And then we looked at all the articles that was there, and we looked at the results to see if it's important, if it gives good benefits or not. And of course, here we found that it did, in terms of effectiveness, you have to have a higher level study, but it did improve children's knowledge, and it did reduce children's anxiety when they went to this kind of setting. Okay, so then we know that, okay, what we're doing now is evidence-based, and it's scientifically, and it's proven. Okay, so that's a systematic review is not an easy task to do, but if you take time and you have a mentor, it's something that is feasible for you to do. All right. There's another thing that is called a qualitative study, whereby you interview different people and you get their idea on something, and you can publish that as well. So when we were doing the Teddy Bear Hospital, we asked the volunteers, we asked some parents what they thought that we should be teaching if we wanted to make this Teddy Bear Hospital for a module to prevent sexual abuse, because we know that the rates are very high, and we need to protect our children and all that. So this is the kind of study that we did as well, and this was, I think this is my latest publication that went out. So this is another way of doing it. Of course, this is qualitative study, so it's not as simple as giving out questionnaires. You're going to have to interview people and get information from there. But in terms of primary care, it's very, very helpful because you actually listen to what your patients say or what your subjects say. And this is something that can be published as well. And we got 4 themes or 4 points that we think is very suitable if you want to use this method. So we asked a lot of people like NGO activists, we asked health professionals, psychologists, and they came up with these suggestions, and inshallah we'll be making a module later on. Okay, so there's a few other things that you can publish as well. Okay, so this is a project done by one of my master's students who is actually a medical graduate, 2 master students who are both medical graduates, but they've decided to pursue on the research pathway. And a few years back, I don't know if you guys remember, or you guys were still medical students at that point. A few years back, what happened was we kind of we had a few reports of a lot of doctors who were involved in accidents, and we really wanted to know if is there anything to do with the driving and tiredness and all that. I think it was 2018. So we came up with a proposal that we wanted to look at prevalence and predictors of road crash involvement among medical doctors in Malaysia. Okay, so we got a grant for that. By the way, not all my research have money funding. this one did. Fortunately, this one did. And we did this as an online questionnaire. Okay, so if you guys can help out as well, we need a few hundred more response. So you can just scan that, and you can have a look at what it looks like. A questionnaire looks like online, and you can actually get people to answer, and you can analyze the data from there. If you notice, this paper is actually a study protocol. So a protocol is, I think Prof. Saiful mentioned earlier, is actually your proposal, and you write it in such a way that the journal accepts it to be written. Of course, you need to register your proposal or your protocol first, but you can actually publish that even before you actually do the research. So a lot of my studies, I've already done a proposal, so much hard work, I try and publish it as well. But the syarat or the thing that you need for publication of a protocol is, it hasn't been done yet, but it needs to have ethics public approval, or you are recruiting and you need to register it in a trial protocol. So you can email me if you want to know more about this. I'll give you the link. So you need to register it in like a known place, so that you can give the number when you want to publish your research. Okay. So other things that you may want to think about publication or doing research so that you can publish is, when I was younger, I used to breastfeed my children, and this is something that I think I'm very interested in. So I looked for questionnaires to breastfeeding practice and support, and self-efficacy, which again is how confident they are in breastfeeding. And we did this in Klinik Kesihatan. And we looked at how good the support is at work, and how good are the parents or the mother is at breastfeeding the children. Okay, so this was also published, and we found that, of course, better work support will lead to better efficacy. All right, so this is what I mean by passionate, because you're involved in that, you understand this topic, right? In terms of me with the training company, there's a training company called Medicorp. They do this thing called a house officer preparatory course, if you've heard of it. And people kept asking, you know, is this intervention, is this module very effective or not? How do you know it's effective? What proof do you have? And usually they would use what do you call it? You know, when people say they are they're happy with it, they would use that kind of response from I can't remember what the word is, but they use that as evidence, but it's not really good or high level evidence. So you want numbers, you want paperwork, and you need that kind of evidence. So what we did was then fine. We did a questionnaire looking into the confidence level of those medical graduates wanting to work pre the course, right after the course, and 1 month after they were working. Okay, so we published the protocol first. Okay, and then when it was ready, we got the result. Of course, we published the proper article. Okay, so this is called a quasi-experimental study, is because it's there's an intervention and there's a post. Okay, so it's something that you may want to think with your patients, or you may want to do this. But of course, we found this one very effective. Increase in readiness to work, increase in confidence to do different things. But it was mostly among those that graduated overseas. Okay, so the next tool that's very important is persistence. Okay, so this is a long list that I can think of that you need to do when you want to publish an article. Okay, I'm not the one, I won't be going through everything, but you know, you have to have a proposal first. So Prof. Saiful covered a bit earlier on. Grant and funding, I covered in red because I want to talk a little bit about that towards the end. But you do not, if the studies that I didn't have or had very minimal funding. If I did have funding, it's because I'm in the university setting and I need researchers or research assistant to do. But if you have support in that terms, you don't really need funding. You can do your simple studies. You need a mentor or supervisor. I think it's very important. You can't do it blindly on your own. The seniors in your setting can help in that. I think I highlighted ethics because I feel that this is one of the most challenging things that I had to do. I think this will be talked about after this, so you can ask the presenter then. Conducting the study, to me, is not so difficult. It's the pre and the post that's is more challenging, I think. Okay, statistics, of course, you're gonna be asking mentors as well. But if you're not doing anything that's like with SPSS, no association, you're just giving the numbers of patients, the percentage of patients, then that's not really that difficult to do in terms of statistic. Finding the right journal and doing the write-up itself, I think the next speaker will talk about that and will help. But again, you're gonna have rejection and you need to revise, but you need to be persistent in that. If you get a comment from a reviewer, just as long as you answer it, usually you won't get a rejection. I think it's just persistence of doing it, okay? And then of course, the proofreading, Dr. Alia did mention this earlier on, and also publication. When you publish, if it's in KKM, you need to tell an MMR that you want to publish, and you need permission to publish that. So that will, I think, will be explained later on. So I think conducting itself, I think it's okay. It's just the pre and post will need your persistence to do. Okay, so here again are the tools that I mentioned earlier on. I'm just going to show it there because I think that's most important about the talk. I'm sorry I can't go through one by one because original articles is a whole array of articles. So I mean, I wouldn't know where to begin if I told you step by steps of writing. But I guess that's where you have to learn from previous examples, and you need a mentor and a motivated team, and all this. Okay. All right, so I'm very happy to announce that IMAM, Islamic Medical Association of Malaysia, is opening a grant. So if you feel that you have a research and you need a grant, some funding to do it, you are more than welcome to. This is our first ever grant. You're more than welcome to fill your names, fill your data, and give your proposals, and we'll be giving out a grant, inshallah, very, very soon. We'll see how it goes. But if you're thinking that, oh no, I still need money, and you do need some money, it's not quite a lot, but it's something that probably can help you out in. Okay, you just need to be an IMAM member. Of course, I said earlier on, you don't have to be a certain religion to be our members, so you're more than welcome to. All right, I think if there are any questions, you can leave in the Facebook thing. If I don't reply now, I'll try and reply later on. Here's my email as well if you need any question, if you have any questions to ask. I think with that, I'm just going to pass on to Fatin.
Thank you so much, Dr. Anissa. It is a very comprehensive talk, and even I'm listening to you, I feel very motivated, especially looking at how you gather your data and your daily routine or daily activities and convert that into a publication. We have a question for you, Dr. Anissa, from Muhammad Azmi Sulaiman. Hi, Dr. Anissa, a very interesting session. I just want to ask, sometimes it is not that we don't want to do study, but somehow when designing or planning for the study, we got stuck with designing the study design, the sample size estimation, the planning for statistical analysis, and etc. And may I know, do you have this problem too? And is there anybody or anywhere that can we get consultation on study design? I think I have the same question.
Yes, this is very interesting question. It's a very relevant question. Thank you for your question. I hope you don't give up on your research. Even in the university setting, I will get questions like this as well. Okay, so it's not you, it's everyone, I guess, especially if we're very young, very junior in terms of research. Okay, so that's why I said my advice to you is to get a mentor. Okay, so try and do something that your mentor has done before. Okay, so if you don't get your seniors, let's say your specialists in your clinic or in your hospitals, maybe you want to talk about, you've seen another article pertaining to that, maybe you want to email that person and get some feedback from them. I do get emails from that, and them asking me, how do I interpret this? You know, like the breastfeeding questionnaire is very common. I get, how do I interpret this and all that? So you can ask certain people. The key is to find the right mentor, I think. And I can't tell you that maybe Heart can do this. There's a group or clinic. In UPM, we're trying that with the clinicians. We're going to have like a clinic. So if you have a problem, you go to this and then you can have a conversation there. In terms of if you're really serious about your research and you want to do with a supervisor, I think Fatin did this as well. You have to approach somebody and ask them if you would like to be your supervisor or your mentor. Okay, it's not an easy thing to do I do understand, but I think the key is looking at the person that would understand what you want to do. And if you do get stuck, you can ask more people. So that's what I mean by being humble. You may, you know, some people may not answer you the way you want, then you look at other people or other researchers that can give you information. You can email me and ask me. I may not know, but I can give you like a link or an email to somebody who I think will know. Okay, that's one thing. But the other thing is, maybe if your research is too hi-fi or too, you know, like intervention, you need medication and all that, maybe you want to step it down and do a simple kind of like cross-section, like a KAP or something like that that can help. What else? Do I get stuck? Of course I get stuck, but I like to ask. So when I ask, I'll have different opinions and I'll go with that. I think hopefully that will answer the questions. Or the other thing is, if you look at examples of what's been done before, let's say they did it in America and you want to do it in your setting, or even it's done in KL and you're in Perak and you want to do that. So it's been done before, that will help you so much. And then you can just follow and you can do in your own setting, and you can email the person, that the corresponding author, and ask them questions with regards to that, and that will help you as well. So I hope that.
Anissa. Thank you so much for the comprehensive answer as well. We are very honored and very glad to have you here today. We hope to get to work with you again in the future. And as you mentioned before, you actually inspire us to the heart admin to actually try to gather the data that we have and probably convert that into a publication. Thank you so much, Dr. Anissa. So now thank you, Doctor. So now let's move on to our fourth speaker. Dr. Anissa has mentioned about the ethical procedure, or has briefly mentioned about how that in order to do research, you probably need to apply for the ethical approval. And we are very lucky today because we have here with us is Dr. Ashraf Shahri Muhammad Noor, which is the head of the Research Registry and Data Coordination Unit from the Ethics and Research Surveillance Sector from the National Institute of Health under the Ministry of Health Malaysia. Dr. Ashraf is also the member of the Medical Research and Ethics Committee, or widely known as the MREC, and is also a member of the Serious Adverse Events Subcommittee Clinical Trial Reporting under the Ministry of Health. So basically, if I was asked what do I know about MREC, I have one answer. Difficult. It's completely difficult. But I think that with our webinar today, probably Dr. Ashraf can help to enlighten me and also all our 150 audience here today how to, what and when to apply for the NMRR. Please, Doctor.
All right. Thank you very much, Dr. Fatin. Hello, everybody. Good morning. First and foremost, I would like to thank the organizing committee of HEART for inviting me to this webinar series. It's such a great honor for me representing the MOH, because I know most of the viewers today are from MOH. So you might have a lot of questions regarding how to conduct study in MOH, you know, because from what we have been listening from our esteemed speakers, most of them are from university, so it can be a different setting and different situation. So I will try to help to enlighten you guys on the procedure and also the process, especially before you start conducting a research, because there are a few things that you need to fulfill first, especially in terms of the ethics part of a research. And a brief introduction, I am Dr. Ashraf, and I'm working in NIH for already about 4 years. So most of you might not know that within MOH, we do have the research institute by itself. We call it National Institute of Health, currently located in Setia Alam. There is 6 institutes under the umbrella of NIH, where we conduct most and a lot of studies actually related to the health, related to the ministry and the policy and everything. So yeah, so the title given to me, okay, let me share with you my slide. Hold on. Okay. Is NMRR, when to apply and how? So basically, I think maybe most of you are quite familiar with NMRR. So I will talk a little bit about, the first is the introduction to the medical research and the ethical principle, because this has been told by the previous speakers about the ethics part of research, because when you conduct a research, you must also consider the ethics of your research, whether it is ethical, whether is it will bring harm or benefits to your participant. Okay, and after that, after like a sneak peek through the medical research and ethics principle, I will introduce you to the NMRR. What is it and how it came about, and also when to apply and how to apply. All right, let's start. So first of all is the introduction of the medical research. So you has been told about the KAP studies, the case studies, you know, how to write an original article. Basically, in medical research, research itself is a systematic investigation, development, testing, and evaluation designed to develop and contribute a generalizable knowledge. Sorry. Okay. So with medical research, it's a systematic investigation involving human subject, as this is used to understand the cause, the development, and the effect of a particular disease, and this also will show or will improved through the treatment, the diagnostic, and the intervention that further on will be used as a care, to improve the standard of care for the patient and to the general public. So basically, with medical research, we are able to compare, and to measure the efficacy of the intervention, because in medical research we do have lots of methodology or design. As in the beginning, we were told by the KAP study, but as you progress in research, you will get to know more. Like, for example, interventional studies, the clinical trial studies were involving the trying of a new discovered drugs and everything. Okay. So what is actually defined human subject? So human subject by definition is a living individual about whom an investigator conducted research by obtaining the data through intervention, whether interaction with the individual or identifiable private information. So why do actually medical research is like very related to the ethics part? Okay, because in medical research, because you are doing an interaction or you are collecting a data related to a specific group of population, in order for you to gain the information that benefit the others, so a few individuals are asked to accept the burden or risk of the research subject. Especially when a group of people are in needs of help. For example, cancer patient, patient with a very rare disease where the treatment are not really established yet. So this kind of research actually can raise an ethical concern, especially with the potential of exploitation and also abuse of the research subject, as what is mentioned in the Principle of Practice of Clinical Research in 2007. Okay, so basically in ethical principle of medical research, there are three important principles. But the first one is we call the autonomy or the respect for the person, where this principle acknowledge the dignity and the freedom of every person. So it requires us as investigator to obtain an informed consent. Okay, when we are interacting with subject, before we even start doing anything to the subject, an informed consent must be obtained, especially when you want to introduce like a drug, for example, or even when you want to collect data through the questionnaire. So informed consent is a must. Okay, but when it comes to secondary data, for example, because it has been collected prior to the study that you want to conduct, so you also need to have actually the consent from the custodian of the data. Okay, for example, the Director General of Health in MOH, or the Director of the hospital, for example. All right. So for the second one, the second principle is the beneficence or non-maleficence. So this is the principle which requires the research to maximize the benefits and minimize the risk associated with the research. So the risk-related research must be reasonable in the light of the accepted benefit of the research itself. And the third principle is the justice, where equitable selection and recruitment and fair treatment to the subject is needed, basically. So I will just explain to you in brief, because if you want to talk about the ethics part of research, it's going to be like a very long lecture. Okay, so basically in our scientific community, there are several international guidelines established in order to maintain the ethical and scientific standard for carrying out the medical research on human subject. The most acceptable one, I mean the most acceptable guideline that we use nowadays is the Declaration of Helsinki by the World Medical Association, and also there is a few other popular guidelines. For example, the International Ethical Guideline for Biomedical Research involving human subjects, and also the ICH, or International Community of Harmonization Guideline for Good Clinical Practice. So one of the things that I would like to highlight in the principle of the Declaration of Helsinki, and this is somehow related to what NMRR is actually in the principle of every research involving human subject must be registered in a publicly accessible database before the recruitment of the first subject. And also the research protocol must be submitted for consideration, comments, guides, and also approval to the concerned research ethics committee before the study begins. So this is based on the Declaration of Helsinki. So this is when NMRR came into the pictures, based on the principle that has been written in the Declaration of Helsinki. The NMRR, or known as the National Medical Research Register, has been established to support the implementation of the National Institute of Health Guideline 2007, which has been revised in 2015 on the conduct of research in the Ministry of Health in MOH. So this is applicable for all of you who are working or researchers who want to do studies in Ministry of Health. So NMRR enable online research registration and online submission, review and approval for the MOH research. So this register also constitute a publicly accessible database on the ongoing and completed medical research projects in MOH and in Malaysia in general. All right, so when to apply for NMRR? So there are a few criteria actually that needs you to register your study in NMRR. Please don't get confused, because there are some of the researchers, the question that I have always been asked is, should I register in NMRR, and is it the same as getting the approval from NMRR? Basically, NMRR is a web platform for you to register your study and to apply your submission for ethical approval to MREC. So it's a two different entity. Okay, so you are getting your ethical approval from MREC, MOH, but you need to register your study and to submit your ethical application via NMRR. So the criteria to register research with NMRR is, the first one, if you are planning to conduct the research involving the Ministry of Health, I will elaborate more about what is it meant by involving Ministry of Health. And the second one is the submission to the Medical Research and Ethics Committee for the ethical review and approval. Also, you need to register with NMRR. And the third one is, if you are planning to conduct your research and you want to apply for the grant, the MOH grant, we call it the Medical Research Grant. So this grant is open for all Malaysian, and the one of the criteria to apply for this grant is you must have a study that can that will bring that can be benefit to the health policy, as well as most likely it will involve the medical of health in terms of either the patient or the data. That if your research are related to this criteria, so you can apply for the MRG grant. And the fourth one is for the approval of publication and presentation. So it might be different from the university, I'm not so sure, but in Ministry of Health, if you are doing a research and you want to publish your research, whether in a journal or in a conference, so you need to apply for the approval from the Director General of Health, and this application also can be done via an MRR. And the fifth one is it's related to the clinical trial conducted in Malaysia. So all the clinical trial need to be registered in an MRR following the requirement of the National Pharmaceutical Regulatory Agency for the CTIL, or we call it a clinical trial import license, and also the clinical trial exemption tax by the NPRA. All right. So when I talk about the plan to conduct a research involving Ministry of Health, so these are the criteria of what is meant by involving Ministry of Health. So for example, if you are doing research involving MOH patient, involving Ministry of Health data, involving Ministry of Health facilities, or you are one of your study team is an MOH personnel, so you need to register your study in an MRR. All right. If you are involving MOH personnel as a study subject, for example, you want to do a qualitative research on the health policy, so you need to interview our DG or our health officer. So you need to register your study in an MRR. And for the all clinical trial in Malaysia, and also for investigator with no affiliated EC or ethical committee, where actually some of the research are required to get the ethical approval from the Ministry of Health as a representative for the ethics committee, which will then you need when you want to publish your journal. Okay, as mentioned by the professor, that when you want to publish, most of the journal editor would like you to have at least a proof that your proposal has been reviewed and approved by the ethics committee. All right. So next is, however, if you register with an MRR, there are some criteria that requires your study to have the ethical approval from MREC. So meaning that not all registration need to have an ethical approval. Only some of the registration requires you to apply for ethical approval prior to the commencing of data collection or the recruitment of the subject. Okay, if the study are involving MOH patient, for example, or are using MOH facilities and MOH data, MOH as a study subject, so your study require to have an ethical approval from MREC. Okay, and also if the MOH personnel are the principal investigator of the study. So this means that, for example, if your study is a study conducted by UPM, but are not involving any of the MOH patient, data, and facility, but you are one of the co-investigator in that study. So you are required to register with an MRR, but you are not required to have the ethical approval from MREC MOH. So if you have the ethical approval from the university, then it's fine, and you can conduct the study and start collecting the data. All right, I hope that is clear. So there are a few studies that you need to register, but you don't need to have an ethical approval, even though it is being conducted in MOH facilities, for example. Okay, so the studies are, okay, the first one is the case study, as mentioned by Professor Wan, if I'm not mistaken. So case study doesn't require you to have the ethical approval, but you still need to register the study in an MRR. Okay, case series also is the same, but in MREC we do accept case series up to less than 10 case series, but it is more than 10, and there is a relation in between those series, those cases, so it is already considered a study, or I mean a cross-sectional study where you do have a association relationship between one of the case series, then it requires to be reviewed by MREC. Next is the systematic review or scoping review or meta-analysis. This has been discussed a little bit just now by Dr. Anissa. So systematic review also doesn't require us to have the ethical approval. The quality is also the same applicable to quality assurance and also the quality control audit and study that is using publicly accessible and available data. So when you are planning to conduct one of these 4 studies, you are not required to have the ethical approval, but you are still required to register your study in NMRR. However, some of the journals are asking you to submit to them like a letter from the EC saying that this study has been reviewed and exempted, for example. So MREC usually will advise the investigator to just submit your application to MREC. MREC will still accept it and they will issue you an exemption letter. Okay, even though you are conducting, the 4 study that I have mentioned now. So how to apply? Actually, registration with NMR is easy, but the ethical part of the study, if you want to apply for the ethical approval, that's going to be a bit hassle, but not that difficult. As for now, if you know the right and correct technique on how to write your proposal in terms of dari segi ethical, dari segi the methodology, then it would be just a short time when you try to apply for the ethical approval. So how to apply or register your study in NMRR? First, you have to log in. Okay, everything is done online now. So at NMRR at moh.gov.my. I'm sorry, actually it's supposed to be nmrr.gov.my. This is the email of NMRR actually. Okay, so you log in into nmrr.gov.my. Okay, if your study have like, for example, a large investigator team, so only one representative from the study team is needed to register the study. So the representative will act as the corresponding person for the registration and the submission for the MREC or the approval or for the grant application. All right. So, however, all the study team must have an account with an MRR. So anybody who doesn't register yet with an MRR, please register so that when you want to register your study in MRR, so the corresponding person can just add to you as an investigator. All right. So and the registration should be done before the data collection and the recruitment of the subject, meaning that before you start your study, so after you have come up with your proposal and everything, so please submit the proposal and the study and register the study in NMRR. Okay, what is required for the study registration? Okay, for study registration, what you need to have and to upload in NMRR is first is your CV. Okay, CV is very important, and the second one is the Good Clinical Practice Certificate, or we call it GCP certificate. Okay, this is mandatory for all investigators involved in a clinical trial and interventional studies. All right, but for the one who plan to conduct an observational study, for example, a case series, KAP study, the cohort, the case control study, so at least one of the study member have the GCP and it should be acceptable. Okay, and the second one is the investigator agreement, head of department, institutional agreement, or we call it IA-HOD IA form. This is needed for the principal investigator of the study team. So you need to download the form from NMRR and get the sign from your head of department and from the institution director or your hospital director, and you need to upload it. And this is just applicable for the principal investigator. So for co-investigator, you do not need to have the IA-HOD IA form. All right, and this IA-HOD IA form is required to the place where you practice or you works. All right, it's not, for example, if you are doing your research in hospital Kuala Lumpur, but you are from hospital Seremban, for example, or from the university, so you need to have the signature from the head of department or place that you are working at the moment, or you are studying, for example, in USM or in Hospital Seremban. All right. And the next things that is needed in registration with an MRR is the study information. Okay, the objective of the study description, the study site, the study investigator list, the number of recruitment, for example, or if you are doing secondary data study, so you need to at least give an MRR the expected numbers of data that you would like to collect. Okay, the inclusion and exclusion criteria and the study period and etc. This one I would advise investigator to copy the information from your protocol. So make sure your protocol have all the information needed. Okay, in order to explain if you are, submit your protocol for the ethics committee. Okay, there is a checklist actually you can get in an MRR. What are the information required for the submission to ethics committee? And usually this submission is already required during the registration of an MRR. All right. Okay. So what is required for the ethical approval by MREC? This is important because it depends on the type of study that you want to conduct. Okay, for example, you want to do a prospective study. So when there is a prospective study, when there is an interaction of investigators with the subject, so you need to have, okay, the first one is protocol, that is a must. The second one is the participation information sheet and informed consent form. Okay, this is for the prospective studies. Questionnaire also is needed if you are doing your study using a questionnaire. Data collection form is needed both in prospective and retrospective study. Because if you are doing retrospective study using secondary data, so usually the ethics committee will require you to have a dummy table of what are the data that you want to collect. So data collection form need to be submitted as well for the ethical approval. All right. And then the investigational brochure. This is applicable if you are conducting an interventional study using any kind of products or drugs. So there should be a brochure explaining about the drugs, side effects, the preclinical studies that has been conducted, the phase 1, phase 2, phase 3 if needed, and etc. And then if you are doing a research involving recruitment from the public, for example, so advertisement, you might need an advertisement, so you need to submit the advertisement as well. So for clinical trial and interventional study, insurance coverage is needed, okay, indemnity. But if you are doing the study in MOH and you are an MOH staff, so you are being covered by, we call it crown indemnity. So you no need to submit any insurance coverage. But if your study are from university or from outside, study sponsored kind of study, so you need to have an indemnity and insurance coverage for you to conduct the study in MOH facilities, for example. And if it involves multiple collaboration, okay, so MOU and MOA is needed and is required by the MREC. Okay, I will not talk in detail on what are the criteria of the protocol, the PIS that should be, but ethically, you should explain, okay, in the protocol, in the PIS, of how you are going to conduct your study, and if the study is ethical to be conducted. So that is a very important things that need to be justified, and the committee members would actually review and see whether a study is ethical or not. Okay, when we speak about ethical, something, to be honest, I know that clinical practice is a different kind of things compared to a research. Some of things that you do in the clinical practice might be on the base of giving compensation or compassionate use. But when you talk about research, it need to be lamented in a way that it is ethical and it is acceptable. Okay, if you said that this particular intervention is okay, even though you are not required to have the ethical consent, for example, in ED, all right? So you need to justify, kenapa, why do you think it is ethical? So this is kind of like a much deeper conversation and also explanation that we need to have if you really want to have an understanding of what is the study conducted is ethical or not. All right, so the timeline for registration of research, usually it takes around 7 working days. It can be much faster than that. But for the ethical review and approval, depending on the risk of the study, so it usually takes around 3 to 6 weeks. Okay, so please bear in mind the timeline so that you can plan your study research carefully. So the take-home message is that before you conduct your study, if you have an idea, plan your study very carefully, especially in terms of the conducts of the study, when to start your data collection, when to submit for the ethical approval if required. So for the ethical approval, please submit the application early as 2 to 3 months before the starting of the data collection. And also familiarize with the local guideline and requirement, because this is very important, especially when you are dealing with, for example, biospecimen or drugs, okay, or especially in the interventional study. All right. So for any inquiry and question, please contact NMRR Secretariat. We do accept all the question that you want to ask regarding the conduct of the study. And also you can contact MRC Secretariat for any question regarding the ethical approval. So a little bit of update, NMRR is currently undergoing migration and development of a new system. Okay, because NMRR has been established since 2007, so it's quite an old system. So we are trying to have a new system which are much more user-friendly, and hope and it will be available to the public, replacing the current NMR system in the middle of 2020. So more information, it will be updated soon, okay, in NIH. So if, let's say, you need some, for example, help, okay, in terms of how to conduct the study, the methodology, the statistical analysis and everything, NIH do provide clinics for the investigators, okay, in the sector of biostatistics and methodology in NIH can have they offer you a clinic to all, or I mean MOH and non-MOH researcher that want to conduct the study, and to have like a consultation with them regarding the methodology and data analysis. Otherwise, for MOH, each of MOH facilities, especially the big hospital, do have their own CRC, okay, Clinical Research Center. So they also provide consultation and also advice with regard to the study if they want to conduct the study in the hospital. All right, with that, I hope it might enlighten you a bit with the research conduct in the medical research. So thank you very much. Back to you, Dr. Fatin.
Thank you so much, Dr. Ashraf. Now I have a clearer mind and a clearer idea about what the difference between an MRR and also MREC. So we're going to take some questions here. There's a question from Muhammad Ikhwan. If a university student wanted to do study in a community using the brand of communities by MOH, such as COSPAN or COMBI, but the study is not related to MOH program or facilities, should an MRR be applied and MREC be subjected?
Okay, for this question, because the brand of the COSPAN and COMBI is actually already become like a tools for you to conduct community study, okay, in public. So if you are a university student, you not need to register your study with an MRR and also MREC. You just need to have an ethical approval from your university, and you can conduct such study in the community.
Thank you, Doctor. So they need to go through their institutional ethics committee to get the ethical approval. Thank you, Doctor. And this is my own question for me myself. So when you apply for the MREC, the principal investigator needs to be usually the principal investigator will apply for the MREC, right? So and the other members or the other investigators ideally should be registered with the NMRR, right? They should have an account. Yeah. So say when the study has been ongoing and then afterwards they are adding more investigators, for example, they're taking the MMed students into the research, should they do an like addendum to that?
Yes. So any additional to the study team, to the study site, or even changes to the protocol, for example, the methodology or anything, should requires an approval given by the ethical committees. So investigator should submit what we call amendment application to MREC with all the information, additional information that you want to add into your study, and it should be approved by MREC first before you can start, recruitment or anything using the additional information that you want. Yeah.
Thank you, Doctor. We have a question from Dr. Alvina Mutiria. I am planning to perform KAP study in the community. Do I still need GCP? And she is the only investigator in that research project.
All right. Because KAP are considered an observational study, so it is not compulsory for you to have GCP. It is advisable at least for if you have GCP, it is good, but it's not compulsory, mandatory. You still can perform and you still can register. And for KAPs, usually it depends on what kind of subject or methods that you want to look at. If the study regarding something that is very common, for example, diabetes, that is not very sensitive. The issue. That's why I said this now. The ethics part of the study is must be very important. If your study is something related to something sensitive issue, for example, HIV, psychiatric issue, so it might requires you to have GCP if needed. So that's why, if possible, you might consult your nearest CRC or the hospital whether it is a requirement or not for you to have GCP. But for most of KAP study, if you are the only investigator, it is okay for not to have, but it is good actually to attend the GCP and to learn more about how to properly conduct the research. Yeah.
Thank you, Doctor. And there's another question about the GCP. How do we apply for GCP? This is a question from Naf Bakar.
Okay. GCP usually in the hospital, they do provide a series of GCP courses. It is given for free. If you conduct in the hospital, you need to sit for an exam at the end, because once you pass the exam, you will be issued a certificate signed by the DG itself. But however, some of the private companies also offer GCP course. You can attend, but you need to pay for the GCP.
Thank you. I'm from International Islamic University Malaysia, and I know my university does offer the GCP as well. And it is it has some registration fee to that. We have a question from our previous panelist, Dr. Anissa Abdul Rashid. Salam, Dr. Ashraf. If I am doing an online questionnaire and it will involve a mix of doctor participants that can involve the Ministry of Health doctors in the clinic kesihatan, where should I put the site of study if it will involve many KKs? And in my previous study, I used an NGO online database. Are there any other ways?
All right. So my advice is that you can put JKN, the state JKN, as because they are the one who are responsible for all the KKs in the state. If your study population are, for example, in Selangor, you can put JKN Selangor. Okay, but if you really don't have really a specific place, or a specific targeted group in the specific places, so you can just put MOH as an umbrella site where it will involve as much doctors in MOH as possible, especially in online questionnaire.
Thank you, Dr. Ashraf. Another question from Zika. Junaidi. Hi, Dr. Ashraf. For a mere questionnaire study, how long will it take for MREC approval? Is it faster? And is it okay to at least distribute the questionnaires to the participants first? What are the consequences of doing so?
Okay, this is very good question. Okay, because first, basically in ethics, in ethical principle of doing research, all research should have an ethics approval first before the conduct of the study, as what has been lined in the principle of Declaration of Helsinki. Because you need to have your proposal be reviewed and approved by an ethics committee first before in the involvement or recruitment of the subject. So for this question, questionnaire study usually considered to be as a minimal risk study, unless your questionnaire is related to something that is sensitive. For example, related to the mental health, trauma, or sexual reference and everything. So that might when the questionnaire is about the sensitive issue, that might need a further review by MREC. So for a minimal risk questionnaire, usually it takes around 3 to 4 weeks, to be reviewed and approved, with condition of your submission is complete lah. For example, your proposal dah complete, your PIS is complete, your questionnaire pun are okay and validated. So it usually takes around 3 to 4 weeks. So my advice is for these things, try to have a look at the checklist that MREC is given, to what are the things that should be stated in a proposal and PIS. So this should help you to submit and to get the approval faster. So for the second part, no, you cannot distribute the questionnaire first. Selagi you are not obtaining the approval, so it is ethically wrong. If we don't have a specific law with regard to that, but if MREC got to know that is happening, so most likely the approval will be withheld. Kita akan tarik balik. Itu saja. And you might be given a warning letter or tata tertib. But as for now, there's no such cases happen yet. So try to do and conduct your study ethically as possible lah.
Thank you, Dr. Ashraf. I would imagine that if you do get into that complicated situation where your ethical approval is not being granted, you probably won't be able to publish your data
Exactly.
at any journal, because usually they will ask for the ethical committee approval.
Yes, exactly. That's right.
Thank you, Dr. Ashraf. That is a very beneficial session for me, and I believe to all our viewers out there. We are so thankful to have you here today, and we look forward to probably invite you for another session probably in the future if you're doing another course on the Introduction to Medical Research. Thank you so much, Dr. Ashraf.
All right, thank you, Fatin.
So we already heard about all the different kind of studies. We have the knowledge attitude practice study, we have the case report, we have the original articles, and we learned about what do we need to do first before conducting these studies. Now that we have the ethical approval, we have the data, we have written our articles, what do we do with the articles? We want to publish it, but where, which journal, how, and all of those things is actually another important step in publication or in medical research itself. And I am very honored today to have another young lecturer here, Dr. Nurhanis Shazni Roslan. Dr. Nurhanis is a medical education lecturer in University Science Malaysia, and she is also an associate editor in the Education in Medicine journal, which has recently been approved for the Scopus Index, right, Doctor? And so Dr. Nurhanis will be briefing us about the process of submitting our article to the journal, about the where and how. So without further ado, I would like to invite Dr. Nurhanis for her presentation.
Okay, thank you very much, Dr. Fatin, for the kind introduction. Okay, Assalamualaikum and good afternoon to all viewers. Thank you for staying with us. I'll be very quick, hopefully. Okay, so I have to congratulate the previous 4 panelists for enlightening us on how to plan a research and when to apply for ethical approval. So the next question is how, where and how do we publish our manuscript? So in essence, an author can do 2 ways. Number 1, they can write and complete their manuscript and then only find a journal. Or number 2, they can find a journal while or when they begin to start their writing their manuscript. So I would recommend the second one because it saves time. And I heard that just now Prof. Alia also recommending the second one because it really saves you time. Okay, so in essence, there are 3 stages of submission. Number 1, first you have to prepare your manuscript first. Number 2 is submission itself. Number 3 is correction. It is very rarely, it's a very rare occasion that you get accepted right away. Even prolific authors, professors, and even senior scientists get rejection or get major correction. Okay, so when you know which journals are you targeting, you can determine your article focus. Number 1, for example, if you are writing, if you're doing a KAP study on insulin injection among diabetic patients, so and you are targeting a public health journals, you have a target already, you may want to discuss a bit more on the health education aspects on top of the diabetes education. Okay, and then by knowing which journals are you targeting, you can read the instruction for authors or the author's guide to know the structure, the sentence voice required, and the citation style, because different journals has different requirements and you have to read the author's guide. So in the past, most journals accept 5,000 words for original articles, but now a lot of the journals have reduced it to 3,000 words. If you don't read the author's guide, you may write up to 5,000 and then you have to redo and cut to 3,000 words. So it's a double work. You don't want to do that when you are busy. And then number 2, some journals has a specific headings or specific structure for different formats. For example, take an example for from MJMS, they have a different structure for original articles and case reports. So you may want to check this first. And citation style is different. Some journals use APA, some journals use Vancouver, all right? And the most importantly is the language aspects. Some, in the past, a lot of journals accept passive voice. Okay, passive voice example is a cross-sectional study was conducted to examine the prevalence of burnout among Malaysian doctors. But now a lot of journals have explicitly required an active voice in the manuscript because it improves the readability. It tends to be shorter. So an example of active voice is we conducted a cross-sectional study to examine the prevalence of burnout among Malaysian doctors. So imagine if you have done everything and then you have to change to active voice, it is such a waste of time. Okay. According to the World Data Bank, there are more than 28,000 journals in 2018 alone, and there are more than 2 billion articles that has been published. So where and how do we fit our manuscript? Before we proceed, I would like to dissect a bit on the terminologies because some of us may not be familiar. So articles is basically our study or other people's studies. Before it is published, it is called manuscript. After it has been accepted and published, it is called articles. There are various types of articles. Our speakers has enlightened about original articles, case reports, KAP studies. There are also other types of articles such as reviews, short communication. Short communication is basically a shorter version of original articles. Okay, and journals is where do we submit our articles, our manuscript. There are 3 major types of journals. Number 1 is it's free for the authors. You don't have to pay submission fees, and it's free for the readers, and it's open access. This is a very ideal journals. Unfortunately, it's not that many, but if you bear with me for another 10 minutes, I will show you a list of these kind of journals. Okay, and there's also journals with subscription or pay-per-view. In this kind of journals, authors don't pay, but readers are the one who are paying. And then there's also open access journals. In open access journals, authors are the one who pay and readers can read for free. So this is a situation where you want to increase the visibility of the findings, especially when you have grants. It is also important to know what volumes or issues this journal have. For example, a bigger volume indicates that the journal has been publishing longer, so it might be more reputable. a greater issues, for example, monthly, a journal who has 12 issues per year may have more publication slots, and they may be able to publish your accepted manuscript quicker. Okay. And what about databases? Okay, so databases list the journals, and the database range or coverage is different from one to another. Google Scholar is the widest and has the widest coverage. Okay, but normally the universities or grants would ask for a journal that is indexed by Web of Science, or popularly known as ISI or Scopus. This is because these two has a stringent quality to select which journal they would like to feature. So Web of Science and Scopus also rank the journals according to quartiles. So the top 25 is Q1 and so on. So you may also want to check whether your universities or grants require you to publish in Scopus, Q2, Q1 and so on. Okay, right. I'm going to illustrate to you some situation. Okay, for example, I have no idea where to publish my findings, but I want a Scopus index journal. So you can go to journalfinder.elsevier.com. All right. So they will give you this interface. Put in your paper title, abstract, keywords, and field of research. Click Find Journals, and you can. They say that there are 26 journals that match your manuscript. So you can use the filter function to adjust. Maybe you want a impact factor from 2 and above. Maybe you want a quicker publication time, or you don't have money, you don't want an open access journal. So you can do this in the filter, and they will give you some suggestion. So from the suggestion, for example, I've picked up Asian Journal of Psychiatry. So they actually summarize to you a lot of information. For example, they give you information on impact factors. Scopus impact factor is 1.9. The time to publication is very quick. It's 7 weeks, okay, but bear in mind that the acceptance rate is very low, and there's a submission or APC, article publication charge, that is $2,270. So it saves your time by having this information in one page. If you are interested, and you can click journal website or continue with submission. If you're not interested, you can go and scroll for other papers. So that's for Scopus. If you want to look for the ISI index journal, you can go to Clarivate, but I find it's quite not user-friendly, so I also included the list at the end of my presentation if you want to download later. If you want to search for journals that is published by Wiley or Springer, there's a specific journal finder for their publisher, for them. Okay, right. For another example is that you have a journal in mind. For example, you are working with an experienced co-researcher, and they suggest, let's publish in this kind of journal. And you want to check whether it's Scopus index or not Scopus index, because you have such requirement for your MET entrance. For example, you can go to schemagojr.com and then enter the journals. For example, Malaysian Orthopedic Journal, and then if it's listed in, if it's indexed in Scopus, it will appear. If it's not indexed, it will not appear. If you click, okay, for example, now Malaysian Orthopedic Journal is indexed, and you click, you can find that MOJ is ranked as Q3 in 2019. And in terms of Scopus, impact factor is 0.25. Okay, and they also suggest to use some similar journals if you want to consider, for example, Indian Journal of Orthopedics and World Journal of Orthopedics. So maybe you also have you have no idea, but you are not, you want to confine your search to Malaysian journal because you think that maybe my finding is very localized, maybe international journal would not find this as, you know, as important. So you want a Malaysian journal, you can go to MyCite. So MyCite is a citation index that gathers Malaysian homegrown journals, and you can go to the list. There's a journal master list that gathers all journals that you can scroll. Or if you want a Malaysian journals that is indexed by ISI or Scopus, there's also a list. But bear in mind that the list is only updated up to 2015. Okay. So when you have identified a journal, you can read the scope. Make sure that it fits the scope. For example, you heard that EIMJ, as Dr. Fatih mentioned, it will be indexed in Scopus soon, and you have a case report, and then you read the scope here. Oh, okay, it's actually specific for education related to medical and allied health. So maybe it's not suitable for clinical case report. So don't attempt. It's just going to waste your time and the editor's time. Okay. I think a very important message in findings journal, especially for a young and beginner researchers, is not to fall into the trap of predatory journals. What happens is that authors find journals, not journals find authors. But in predatory journals, they find the authors. Okay, so we know that it is not right when a journal emails you to publish, inviting you to publish. That there's a high likelihood that it is a predatory journal. So if you want to check, you can go to bellslist.net. So Jeffrey Bell is a librarian from United States that has kindly gathered a list of predatory journals, and the characteristic of predatory journals are as this. But the three major traps that young researchers always fall into is, number one, these journals normally has a weird website, has a very funny looking website, and it features a high impact factors. But that impact factor is not really a Scopus or ISI impact factor. It is something sometimes they create their own. So you might be tricked. Okay. Number two is they promise a very rapid publication. Rapid in the sense like 7 days or 2 weeks. So it is very questionable, like how do you get peer review to do such a quick decision in 7 days? Okay. And then they, because they want to compete with the open access reputable journals, they offer a very low charge, like $150 for example. But not to deny, there's also a good journals that offer a low charge. But you have to see whether this is a predatory journals by checking. Okay, once you start submitting and your email is circulating, sometimes these predatory journals invites you every day. I get the email from predatory journals every day, and they offer me a very quick publication time, like 2 weeks. Sometimes they know young researchers lack of recognition, so they start calling you professors and experts. And don't be tricked by this, okay? Because once you publish in predatory journals, it's not good for your CV, especially if you are in academia. Number two is that people won't likely to trust the article. So it's quite rugi lah. You publish and then people baca, oh, this is predatory journal, tak nak cite, okay? So it's not good. Right, once you have done with identifying a journal and writing your manuscript, then comes the submission process. First, check whether we have followed the guidelines as we have discussed, and check who deserves to be an author, write a good cover letter, and upload all the required documents. We have a question just now, who deserve an authorship? So most of the journals follow the recommendation set by the ICMJE. So authors or co-authors should meet these 4 criteria. Number one, they should contribute to the study. By saying contribute, it can mean contribution to the study design, data collection, statistical analysis, okay? So if case report, maybe they have contributed in the patient's progress or treatment or management. And not all, and they are involved in drafting the work or give a critical feedback to the work and give final approval and agree to be accountable. So if you have your colleagues that you want to include and probably you write the whole thing, make sure that you also give them the draft for them to read and give approval, and make sure that they agree to be accountable for the work. So that will qualify them as a co-authors or authors. Right. And I find that a lot of people just copy and paste the cover letter from internet. This is an opportunity missed, because when you submit, the editor will first screen, and one of the screening criteria is the cover letter. So we should take this opportunity to write a very good cover letter to say why does our findings or our manuscript deserves to be published in that journal. So say like, we believe this manuscript is appropriate for publication by such and such journal because our finding such and such. So how does it entertains or it serves to our readers? So this will make us more interested. Oh, okay, we should send this to peer review because the findings is specific to our readers. Okay, you can also include reviewers that you want to suggest and reviewers that you would like to avoid, because sometimes we know there are different school of thoughts and you want to avoid such reviewers with a different school of thoughts. Okay, so you can do that. All right. When you submit a manuscript, there's a different kind of fate. First, during the first screening, an editor may return without review. So this is a nicer term for outright rejection. But don't be sad because everyone will face rejection. Okay. Sometimes they feel that it doesn't match the journal scope and they will recommend to submit other journals to other journals. Number 3 is they feel that this is a potential manuscript and they will send to peer review. So normally a journal will have at least 2 peer reviewers. Number 1, a lesser likelihood is that the peer review will accept without revision. Number 2, accept with minor revision. So in minor revision, you just have to do the correction and the editors will check the revision. Number 3, accept with major revision. In these instances, the revision will be sent back again to the reviewers and you have to address it point by point. So it kind of goes through another round of proper review. All right. Number 3 is that the reviewer wants to reject but feel there's some value from these findings. So they will say revise and resubmit as fresh submission. Number 5 is reject. Okay. So if you got major correction or rejection, don't get mad.
Dr. Anis, we can't hear you. Probably there's some connectivity issue here. Okay. I think Dr. Nurhanis get disconnected just now. Okay, you're back in the show.
All right. Okay, sorry for that. Is this the last slide that got disconnected or is it the previous slide? This is the slide.
This slide, the current one.
All right. So during revision, so you if you face revision, major revision or rejection, you can get mad, but get over it. Use the correction or the feedback given by the reviewers to improve your manuscript and resubmit. Okay, make sure you've kept the literature review in the folder to save your time. Okay, and address the revision point by point. If you face a major rejection, you can also disagree to some points and you can provide a rebuttal, but explain it politely. And when you compose a response letter, make sure that you acknowledge time and efforts by the reviewers. Okay, so politically correct as well. Okay, so I would like to share the 10 most frequent reasons for rejection, and 5 of it involve results. For example, incomplete statistics, insufficient data, sometimes overinterpretation of results. Sometimes it involves methodology, for example, inappropriate instrumentation, questionnaire not validated. Okay, sometimes the literature review or discussion use reference that are very old. So journals prefer citation that prefers that author cite journals that are less than 5 to 10 years old, except for a groundbreaking or landmark papers. So you have to check that. Because when we cite a very old article, sometimes we miss the gaps that has been addressed by newer articles. If you were to dissect the reasons for rejection based on the structure, sometimes in the literature review, authors fail to demonstrate the gaps. So when gaps is not demonstrated, then it doesn't justify the current study. Okay, so we have to demonstrate the gaps. Number 2, methodologies issues. As I mentioned, sampling, statistic, validation, especially when involved questionnaires. Number 3, in interpretation, sometimes the discussion is inadequate. It doesn't link the findings to relevance to practice. There's no alternative explanation, or the conclusion does not tally with the findings. Overall, sometimes there's a lack of organization in terms of sentence, sometimes English issues, inflation of the findings. Okay. So I understand that when you are working, especially in medical field, you may not have much time to endure indulge in writing articles. So some save your time tips, especially if you are very, very beginner. You can start by looking a very similar article that you are trying to write, as what Dr. Anissa mentioned just now. So for example, for my first article, I wanted to write about professionalism among Malaysian doctors. So I found this article from United States. So I actually dissect the paper. So the first sentence talk about the needs for having a professionalism framework, the long-term impact, and so on. So it helps me to form or to structure my own manuscript, you know, like doing a karangan in our primary school times, okay? Number two is if you have a thought block or you don't know how to say things because you want to avoid plagiarism at the same time, you can go to Phrasebank, Manchester, and they actually offers you several ways to say things. So they have divided the website into introduction, methods, results, and findings. So that they have suggest different ways to say things. So it kind of gives you more flow of writing. This is free of charge, but if you decide to download the PDF version, then you have to pay £5. So it's actually quite similar. So if you don't want to pay, I just recommend for you to go online. So this is the example of the PDF version. Okay. The next tips is use Citation Manager. I know a lot of people try to avoid Citation Manager because they feel that it's complicated, but trust me, it's not. It saves your time because when people do it manually, a lot of time we will find errors and it will annoy the editors and the technical editors because we have to comments and you have to resubmit and stuff. So Mendeley and Zotero is free of charge. So EndNote needs some subscription. For example, you are submitting to a journal A which use APA and then you got rejected. You want to move to a journal B which use Vancouver. With one click, you can just change the citation to Vancouver rather than doing it manually. It will take a whole day. Number three, you can use professional editing or proofreading service, but of course you have to invest some money. So they will make sure that the tenses are correct, the format is correct, and so on. So if you are targeting a very high impact journal, they may want a native speaking proofreading or international proofreading service like Elsevier, but this is very expensive. We also have a local proofreaders. I think the Facebook is Proofreaders United. This is a bit cheaper. Right. When making it through, imagine that you are proposing to the editors or to the reviewers, and there are 4 elements that we may ask. Number one, you may say no one has done it before in Malaysia, but reviewers or editors may ask like, what's new? So if someone has not done it in Malaysia, what's new in terms of the knowledge gap? How does this bridge the knowledge gap before? Okay, number 2 is so what? So how does the findings links to a practice or clinical practice? So number 3 is why so? Is the methodological aspect is sound? Whether the results is correct, and so whether the logic is there for us to support to accept the findings. Number 4 is whether the whole manuscript is well done, is written carefully, it has demonstrated the gaps, and the finding has filled in the gap. Okay. Another tip is always look out for special edition, because in special edition, editors have to find articles or manuscript that has a similar or related title. So the chances of you being accepted is higher because they have to just select that kind of articles. Okay, I mentioned that at the end of my slide, I will share some Scopus Index journals that has no publication fees. And so these are some of the journals. It is not exhaustive list. There might be more. So you can try some of these journals. Okay. Right, so these are my references and you can download the slides and the Web of Science or ISI Index journals via this QR code. Thank you so much.
Thank you so much, Dr. Nurhanis. It's a very comprehensive briefing. I would like to say that I totally agree with you with all the tips on saving the time. Using the academic phrase bank is probably the most useful thing for me in my PhD journey. It's just that I'm stuck I started using it a bit late in my study. I can imagine how much time I can save by using that early on. I'm gonna take some questions here. We have one from Dr. Wan Ashraf Wan Zaidi. Schemago may not be as updated as the journal citation report. You can also, sorry, this is not a question. This is just a comment. But you can also check here at this website, the Clarivate. To check out the index journals.
Yeah, I agree because as I mentioned, the Schemago only lists the Scopus Index Journal. So they offered a different ranking for Q1, Q2, and the impact factor is SJR. But ISI has a different list in terms of the quotas and the impact factors. So the list can be accessed through the link given by Dr. Wan Ashraf, or if you cannot access, you can download through the QR code that I've given. Okay.
Thank you, Dr.
Right.
Ashraf and Dr. Nurhanis. Just waiting. If do we have any more questions? Okay, we have another question from MBS. Hi, doctor. First question is, what does impact factor means? Second question is, how does the journal is chosen to become a Scopus or World of Science index? And number three is, what does it mean by the index versus the non-index journal?
Okay, thank you, Dr. MDS. So I start with question number 3. So what does it mean by index and non-index journal? So when it says index journal, we have to be more specific, like which database are they referring. For example, Scopus Index Journal means that the journal is listed or indexed under Scopus database. If it's a ISI Index Journal, that means that the journal is listed under Web of Science, or known as Thomson Reuters as well, or ISI database. So how does this database select journals? They have their own criteria. So one of the major criteria is the journal has a stringent peer review process. They have some sort of model in their the journal has some model macam business model ke apa ke. Lepas tu they also have a high citation index or high citation activities. Okay, from our experience in EIMJ, we felt that the ISI criteria is more stringent. Maybe that's why some people say that ISI index journals are macam better quality lah. But of course, this is subjective. So how does impact factor, the first question, how does they calculate impact factor, is a weighted citation for the journals. So journals has a lot of manuscripts, so they will calculate the average or the weighted citation. For Schemago or Scopus is over 2 years. For Scopus is over 3 years. Okay, for ISI is over 2 years of citation activities. So that's why ISI is sometimes deemed as a higher or better quality, because the way the citation index is more stringent, is much more narrow. The time gaps is just 2 years as compared to Scopus that are 3 years. I hope that answers.
Thank you, Dr. Nurhanis. Let's see if we have more questions from the audience. Thank you to the 127 viewers who are still with us now. We're going to take another question from Dr. Iman. Salam, doctor. Is there a limited time to publish a completed study? For example, if the study is conducted in 2018 and is completed in 2019, when will be the final time that we are able to publish the study?
Okay, thank you, Dr. Iman. Basically, there is no time limit. Sometimes we have authors submitting their manuscript with findings done in 2009, 2010. As long as the findings are still relevant now, then you can always submit. Sometimes, if in a very fast-paced field, then maybe you want to publish quicker, because in 1 or 2 years time maybe it's not going to be relevant, or a lot more people have published on that. Okay, so the answer is there's no time limit. It's just like whether it's going to matter now or it's not going to be relevant now.
Yeah, I would imagine so, doctor. Say if the study was done during that time and there is that research gap there, and if that research gap is still relevant today, it's always relevant to still publish that data. Okay, another question from Dr. Rizwan. Dr. Hanish, which one do you prefer in terms of the citation manager, the EndNote or the Mendeley?
Okay, I'm going to be very biased on this because a lot of people have used EndNote. In USM itself, they used to offer EndNote to their staff and students, but I never use EndNote. I use Mendeley from the very beginning, so I stick with Mendeley, and of course I prefer Mendeley because it's free. And I think the interface is quite easy to use. So if I am a student, now I am in a university that provides a subscription, I may want to stick with Mendeley because after I finish my masters or my students here in university, then who am going to pay for the subscription later? When you have built up such a huge articles in your citation manager, you want to maintain it. So maybe Mendeley is the way because it's free. Okay. And there's a lot of online YouTube online tutorials on how to use Mendeley, and I think it's quite straightforward.
Thank you, Dr. Hanis. I would agree with that as well. I think Mendeley is a very user-friendly citation manager, and because it's free, it is accessible to everyone, and I mean that even if you move from one institution to another, your database that you have built up in the Mendeley is still relevant to you, and you can still use that. Another question here from Muhammad Ikhwan. What is considered as high impact journal, and does the high impact journal equal to Scopus Index journal, and does Q3 and Q4 considered as high impact journal?
Okay, thank you, Dr. Muhammad Ikhwan. First of all, high impact journal is quite subjective. It depends on how the institution defines it. Some institution says we want ISI impact factor more than 2, more than impact factor 2. So I guess you have to get back to the institution or to the whatever grants that you have to fulfill. So when you say does high impact factor equal to Scopus Index journal, may not be so, or may be, because some institution they benchmark according to Scopus. Some institution benchmark according to ISI. So you have to check again. So normally when they say high impact, a lot of institution use Q1 and Q2. But again, you have to check whether this is Q1, Q2 Scopus or Q1, Q2 ISI. Okay.
Okay. I hope that answers Dr. Ikhwan's question. Let's see if we have another question from the audience. Are we taking more questions? From Dr. Z and Lee. Good afternoon, doctor. In terms of getting married by publishing journal, is there any saying like only the first 2 authors will be considered?
Okay, thank you, Dr. Zian Lim. First of all, I'm not sure whether I got this correct. The number of authors, some journals restrict number of authors to 6. Some journals do not restrict, especially in a very big studies that has a lot of collaborators. Okay, but then some, in terms of who can be first author, some journals says only one person can be first author. Some journals say they can be 1 or 2 first authors because the manuscript is equal in terms of the expertise. They are divided between 2 expertise. So 2 people needs to be first authors. Okay. So you have to check why first authors or corresponding authors needs to be a certain before submitting, because especially in universities or in academia, first authors and corresponding authors also matters in promotion. So you may want to check with the journals and agree with the co-authors. Okay, I hope that answers.
Thank you, Dr. Hanis.
Right.
We have a link here that is shared by our previous panelist, Dr. Anissa. Check out Zotero. Zotero is another citation manager, and it's free, and we can use it online via the Google Docs as well. Thank you, Dr. Anissa, for sharing this information with us. I think that is all the questions that we are going to take today. But if you do have any more questions that we have not addressed here, don't be disheartened, because your questions will remain in the Facebook page, and our panelists may get back to you after this by replying to your comments. Just to let you know that this recording will stay in the Facebook page of Heart, and you can rewatch this, and we would really appreciate if you can also share this recording to your friends who may benefit from this webinar today. I would like to express my heartfelt thank you and appreciation to all of our wonderful speakers today, Prof. Saiful, Dr. Wan Alia, Dr. Anissa, Dr. Ashraf, and also Dr. Nurhanis. We will really appreciate if all the viewers here can fill in the feedback form after this. The link is given in one of the comments in the Facebook page. Your e-certificate for the attendance will be emailed to you within 3 days once you have filled in the feedback form. I would like to also announce that we are going to have another webinar in 2 weeks' time on the 13th of March with the title of Road Less Taken, the Medical Ethics and Jurisprudence. I hope to see all of you again there. With that, stay home, stay safe. Thank you very much, and have a nice weekend. Thank you, everyone.